in miscellaneous line of business, we completed all other miscellaneous, including rural and also liability in the last session. Today we are going to discuss about the last part of health and travel insurance product. But what I would like to tell you, for all other part of miscellaneous business, if you would have gone through the book IC 78 and also some of the updates in the IRDA site, that is enough. But for health, it is not like that. You must understand that, because the part of or the portion that is covered in IC 78, that is in miscellaneous book, it is not enough for your exam. Please understand. So what you have to do, you have to prepare in a different way. Why should we give more importance to this line of business? That's more important. See, for example, there are 22 private insurance companies are there and 4 public sector. Of course, 6 public sector, 2 is not doing health. They are the, that Agriculture Insurance Company Limited and ECGC. Apart from that, our 4 brothers, New India, United India, National and Oriental, plus 22 private companies, plus 7 standalone health insurance company. So there are almost 26 plus 7. You just calculate. So much of insurance people are there to cover health insurance in India. And the most important part of this line of business, when all other general insurance portfolio are growing 80% per year, 18% per year, and this line of business is growing every year not less than 32 to 35%. And this is the one portfolio that gives lot of penetration in the insurance sector as long as in our country. That's why I would like to tell you, India has become one of the top 10 general insurance industry in the world. Earlier it was not top 10. Only LIC, life insurance only was top 10 industry in the world. But in today, as on date, the general insurance industry also become top 10 industry in the world just because the way the health insurance portfolio is growing. That's why it's more important for your examination. There would be definitely minimum 6 to 10 questions to be coming out of the 30 questions that is appearing in miscellaneous. So that is why you should give importance to health insurance policies. Of course, as I told you, you cannot read the exclusive health insurance book by institute, that is IC 27. Of course, IC 27 also you need to have a glance. But what I am going to help you, you need not worry about those books, about IC 27 or IRDA regulation, something, don't worry about that. If you are going to be with me today, forenoon class, throughout the session, mentally and physically with me and walk along with me, I assure you the slides and the subject matter and the informations what I am going to share with you, that is enough for you for your preparation of exam. Only thing, if you want to recall, you can just have a glance about the PowerPoint slides, what I have already shared, and as well as I am going to share with you today, this health insurance PPT. So what I am assuring you, don't worry. You may not think, you don't think that miscellaneous is a very big portfolio. It's not like that. It's all how much of interest you are taking towards that particular line of business. Of course, you are all there. You already covered the other part of miscellaneous. Today we are going to discuss about health insurance policies. Here, the first intro, I would like to tell you something, why it is important. I already told you, this is one of the growing sector. See, already the insurance is called sunrise industry. Sunrise industry means there are a lot of portfolio to be exploited. So much of potential. Out of that, health is growing like very big. In fact, spectacular growth is seen the last few years. That's why there's an assured growth of 30 to 35% in the general insurance industry. That's why this line of business is important. While preparing for exam, you must understand, it's not that only reading the book is enough. Of course, the part that is there in IC 78, the miscellaneous book, is not at all enough. So you don't rely upon that particular part, but I'm going to cover that also. Don't worry. If you see the PowerPoint, that is enough for you. Of course, you have to also have a glance over the exclusive health insurance book, that is IC 27. That is also I have taken up I have also taken all the important points for your exam. I'm going to share with you in this PowerPoint presentation. So you need not go and buy the book, you need not go through the book, but if you are going to be with me for the forenoon class and you are going to have a glance about my PowerPoint presentation slides, that is enough for your exam. I'm assuring you, if there is even 10 questions comes out of health, all questions you can pick up the right answer. There will not be any difficulty. Okay. Then, coming to preparation for exam, as I told you, you have to concentrate on the subject matter that is relevant to all 4 companies. For example, if you take some products like gold, platinum or senior citizen, though the name is common for all 4 brothers, all 4 companies, but there are some small changes are there between the companies. So I am not going to the company specific products. I am only going to share with you that is common for all of 4 public sector companies. And that's more important. There are some products that are not there in all other companies. For example, long before, few years before, there was no super top-up policy in other 3 companies. Only United India has actually launched that product years before. But now subsequently almost all the 4 companies have got the super top-up product. But one thing I would like to tell you, the name may be common for all 4 companies, but there are some small variations there among the companies. That's why I'm not going to touch the variations. That's not enough. That is not required for your exam. But what is common for all the 4 companies, that's more important for your pre-promotion exam. So how to prepare for pre-promotion exam as far as health line of business? That's what I'm going to tell you first. Second, I'm going to tell you the common template. That means the coverages, exclusions, that is applicable for all 4 companies. I'm not going to talk about specific to each company. I'm going to talk about common for all 4 companies. That's called common template. Though the name may be there, for the age group may be common. Okay, the coverage or the exclusions may be common based on the IRDA regulations. But there may be some deductibles, there may be some co-sharing. All these are differs to different company. I'm not going to touch that. But what is important for you, I'm going to touch that. Okay. Then coming to the third part, today I'm going to discuss with you IRDA regulation. That's more important because IRDA is the master, and especially they are concentrating more on health insurance line of business. And every time they are coming out with a new regulation or modifying the regulation which already they made. So there will be revisions of regulations coming. One time they are still telling something, and the other time they are telling coming that they are putting a new regulation. So you don't bother about, there are multiple circulars are available, multiple regulations are available in IRDAI site. But if you go through that, you will get confused because it's a very lengthy circulars. So you don't worry about that. All important circulars for your examination point of view, I'm going to tell you today. So if you be with me during this presentation, that is enough for you. Again, IRDA has also come out, you know that there is a standardized products. That means IRDA has told all the insurance companies, not only the public sector and also the private sectors, they must launch this kind of product. There should be a commonality among the product. See, if they say one particular product, and that product should be available with all general insurance company, including standalone health insurance company. The cover, the exclusions, and everything must be the common. There may some products, they may have a different premium rating, but I'm not going to talk about the premium rating also here, because even though among the 4 companies we have a different premium rating, even the common products like platinum, gold and senior citizen. So I'm not going to touch that. That's not good for you for exam also. But the standardized products that must have a common template for all insurance company in India, that you must know, because that is common to all our 4 companies. The last one, many times the questions are coming in the exam. How far you are updating your knowledge with the insurance, health insurance line of business? Because you may be thinking, why should we learn about central government welfare schemes? My dear friends, please understand, I am not going to discuss with you today the state government schemes, because state government schemes differ to different states. That is not common to all 4 companies. What I am having in Tamil Nadu, that may not be there in Karnataka or Kerala or in Maharashtra. So there is no use of learning the state government schemes. Even though our insurance companies are having association with the state government insurance schemes. That is not required. But central government insurance scheme, that is common throughout the country, where our 4 companies are associated in the claim settlement and the underwriting. So you must know what are the important schemes, how do we go through, how do we act with the government people, all these things, some important points for your examination, you must know. So now we will get into the subject. I already told you why this subject is very important. Now, how to prepare for pre-promotion exam. Okay, come to the subject. See, I take one small example. First, when a question comes in the exam, please understand the question. And just don't in hurry try to select the best answer. Try to understand all the answers. Select the best answers out of the 4 objective type. This I have already told you. So the subject matter, what the question is asking, it's relevant to what subject matter. For example, today, before getting to this exact subject for your examination, I'm going to trigger your mind, because triggering your mind is more important, because you are not a homogeneous group. As I told you, you are a heterogeneous group wherein there are juniors, there are seniors. So how the questions will be framed in health insurance for juniors, how the questions will be modified in health insurance for seniors, that you must understand. There is nothing wrong the juniors to know how the question will be in seniors, but if you are interested, you also learn that also, because sometimes the same questions what we are discussing with you for preparations may not be the same questions in the exam. There may be some modifications, but you will be able to pick up the right answer if you understand the subject matter of the question. Today, before getting into the subject, I am going to take the first subject matter, health in the health insurance, free look period. Some say free lookup period, some say free look period. Okay. What is this free look period? You just trigger your mind. Just recall what all you know. You may be a junior in front of me. Of course, those who are attending this session, some of you may be junior, some of you may be senior, some of you may be even very seniors and in a higher post. Whatever it may be, just recall what is this subject matter, what is this free look period. Everyone tell immediately one answer, sir. It is very easy, sir. Free lookup period is only 30 days. Within the 30 days, if the customer or if the insured, he doesn't like it, he can return the policy, he can get back the premium amount. That's what you may say. No, dear, it is not like that. Whenever you read a subject matter, you have to go in little in depth. For example, free lookup period. What is free lookup period? First, you should understand. It is a particular regulation made by IRDAI to protect the interests of the policyholders. So that is more important. Why this particular clause has been made mandatory, compulsory, or it should be practiced by all companies? Because it's a part of protection of policyholders' interest. That is why we have to protect the interest of the policyholder. He doesn't like it, let him return. You pay back the money. But how are you going to pay money? That's all different. Then, apart from that, what is more in the subject matter connected? The period duration is 30 days. Okay. So within 30 days, he got a policy, or the policy, whether it's commenced or not, he can take a decision. Whether he is happy with the policy, he can continue. If he doesn't like the policy, he can return the policy. So the 30 days is a pre-lookup period. Okay. And yet, whether it is applicable to all health insurance policy? No, dear. It is applicable only to the annual or more. For some policies are long-term policies also there. What are the long-term policies in health insurance? I'll tell you later. So whether it's applicable, so it is not applicable. So you must understand, it is not applicable for short period policies. It is only applicable to annual or more duration. That you must understand. Then, how the insurer is expected to act, suppose during a pre-look period, that is more important. See, the insurer going to act when he is returning the policy. How he is going to act? Whether he is going to refund the entire money, or he is going to withhold some part of money. How he is going to act? All these things you should come to your mind when you think of pre-lookup period before preparing for exam. Simply saying 30 days and going for the exam, that is not enough whether you are a senior or a junior. For example, I'll tell you, for juniors, the question may be coming like this. Rahul has obtained a health insurance policy with a term of 1 year. See, note, I underlined that. Why? The question itself is making you to understand what they are expecting from you. So, it is 1 year policy. So, you must know as a candidate, oh, it is applicable. If the question says 6 months policy or 3 months, 3.5 months policy means automatically there is no question of pre-lookup period. So you can select the right answer. We cannot, it's not applicable. So the question is just by telling you some words, 1 year, that means it is applicable. Not satisfied, yes, is eligible to return for refund. That is also in the question. Then again, cancellation on the 20th day. Oh, that is also important. That word is also because he is trying to give the cancel the policy within 30 days. He is not trying to return the policy after 30 days. If it is after the return policy, there is no question of eligibility. So the question is just beautifully coined to make you understand whether you really know about all aspects of pre-look period. Then how do you respond? The insurer respond when claim comes. See, he did not make any claim. Here also they say he did not make a claim. So he did not make a claim, he is eligible. He is doing within 30 days, he is eligible. He is not satisfied, he is eligible as per the protection of policyholder's interest. If the policy is for 1 year, he is eligible. So you have to select the right answer. Now come here, refund of premium is not possible. No, this is not the right answer. Refund of amount would be considered in full. That is also not right answer because this man has enjoyed 28 days. So the risk has already commenced. If the risk has already not commenced, okay, we can give the full premium. But risk has already commenced. He was enjoying for 28 days before taking a decision to cancel. So a part of risk already taken. So for that we have to deduct. So this is also not correct. Refund amount would be considered on pro rata basis of the balance period. Refund amount would be considered on short period basis. Oh, here out of the 4, the best answer is C because it will be considered on pro rata basis. This is enough for juniors. The same question, if it is designed for seniors, how it would be? Please see that. How it would be? Please see that. Rahul has obtained a health insurance policy with a term of 1 year as 365 days by paying a premium. See, some new words are coming for seniors. 9,500. He is not satisfied with some of the terms and conditions, requested to the insurer for cancellation on 20th day. Okay. Then he did not make any claim. Okay. But incurred 440 towards pre-medical exam because insurer insisted for a pre-medical exam. So he has already paid 450 and sought by the insurer along with the proposal. How does the insurer respond to his request? Now you see, this man has incurred medical expenses, pre-medical expenses charges. He has paid a premium of 9,500. This is all additional information for seniors. So you have to select the answer. The answer could be 2 different ways for seniors. One may be a normal answer that is non-numerical. Another answer may be a numerical type. So you may have to use your calculator and find out what would be the amount of refund. So here you see the first non-numerical. Refund of premium is not possible as it exceeded the stipulated fee. No, it's wrong because he made claim within 30 days. Refund amount would be considered in full. What received from that is also not possible because he has already enjoyed 28 days risk. Refund amount would be considered on pro rata basis for the balance period, excluding the cost of medical checkup incurred by the insurer at 50% because as per IRDA regulation, when an insurer insists for a medical checkup, they have to bear 50% cost plus stamp duty. So here you see, he has already enjoyed the risk for 28 days. So definitely he is cancelling the policy. So naturally the insurer has to deduct stamp duty and 50% of amount what he has to incur or paid for the towards medical costs. Refund amount would be considered on short. This is not right. So the right answer is C. Suppose the question is numerical form. It's a non-numerical form. The question is a numerical form. What would be the answer? By refunding a premium of 9,500, the full premium, no, it's not right. By refunding a premium of rupees 8,771, whether it's right, we have to think. By refunding a premium for 9,500 minus rupees 729. Why 729? The 28 days this fellow enjoyed. So pro rata, we assume the risk. If you would have made a claim, you would have paid the claim. So that amount we have to deduct. Plus 225, what we contributed as an insurer, medical expenses, pre-medical exam, that should be also deducted. Already the risk was existing. before cancellation. So stamp duty should be also existing. And the last one, refund of premium is not possible. No, that is also. So the right answer is this C. How I have arrived this? See, 9,500 divided by 365 days. So per day premium is 26 rupees. Into 28 days it comes 728. That should be deducted. Plus the part of medical expenses borne by the insurer, the company, that should be deducted. Stamp duty deducted. So the right answer is C. Now you are understanding? You may think, oh sir, free lookup only 30 days, you would have skipped and next, you would have gone for next question. No, my dear friend, every question has got lot of in-depth detail. Every answer has got lot of in-depth detail. Please don't skip and go to the next question. Understand thoroughly each and every question and proceed to the next question. Okay, we'll go to the next question. Now I am going to the next question. How this free lookup period is based on? You see this IRDA regulation, they are clearly mentioned. If the insured person has not made any claim during the period, they are entitled to a refund. If they made a claim, not refund. Understand? And they have given this is a regulation. What I am showing is a regulation in the IRDA site. They clearly mention if the risk yet to be commenced. Suppose you issued a policy, not immediately the risk commenced. For example, he has paid the premium, but he wants to have the cover from. He paid the premium 10 days before, but he wants to have a cover only after 10 days. But before this commence, he has cancelled the policy. In that case, you cannot deduct any premium on pro rata basis. Only you have to deduct administrative expense of stamp duty and initial medical cost to be deducted. That is what IRDA regulation says. In case already the risk commenced, that is, he enjoyed 28 days, there you can do the deduct the premium amount corresponding to the specific coverage period on pro rata basis, addition to the medical exam is borne by the insurance company, then stamp duty. So based on this regulation only, you have to select the right answer as far as pre-look period is concerned. So this is the regulation. I just copied the regulation for your understanding and made it. Now we'll go to another model question. New India Assurance Policy Period 1/7/2018 to 36/2019. Okay, for is 5 lakhs. United India policy is 1/1, that is after the policy. Easy. To 18, it is 19, 3 lakhs. But he admitted, the person has admitted on 1st March 2019. This particular date of admission falls in both the policy. Please note it. Please note down. It falls in both the policies. And discharge on 6th March, it also falls on both the policies. Even if it is not falls on, once the risk commenced during the course of the policy period, we are liable to pay the claim, that you know that. So it's here both the claim as well as the discharge also falls in the period of the policy, okay, during the course of the policy. A claim amount of rupees 3.80 lakhs plus non-medical expenses of 20 lakhs, 0.20 means 20,000. How the insured can make a claim? This question is there. So see, there are two policies. Please understand. All two policies they existing, and the claim falls in both the policies. So he is eligible to make from both the insurance company, and the claim is not only for the medical expenses, admission and medical expenses, and also for non-medical expenses of 20,000 rupees. How the insurance is going to proceed? The insured is going to proceed. He will get policy from A company, that is NIA and UIIC proportional basis. Is it right? No. First from UIIC and the balance from NIA. Is it correct? No. First from NIA and the balance from UIIC. No. Then what is the answer? Claimant has the right to choose the first and second. He can select any company. You cannot say like in the olden days. Olden days, what we used to say, no sir, you first get from the first company, the balance you come to us, we will settle the balance amount from the second company. No. Now the insurer, the claimant has got the right to select whether to get the first claim from the first company or a second company. Why? Why this benefit is given to the insured? Why the benefit is given to the claimant? Because protection of policyholders' interest. Why? Because in New India there may not be a co-share, or in United India there may be a co-share, or in New India there may be a deductible, or in United India there may not be a deductible. And non-medical expenses he would have not covered in New India, but he would have covered by paying additional premium in United India. So he thinks, if I make a claim from this company, they will deduct all kosher, deductible, they will not pay for non-medical cases. Then why should I get a claim from that company which is not going to pay? So I will get the another company which is going to pay. The balance I get from the another company. So he has got the right to select the insurer, the company. That is why this is D is the right answer. So please understand. Question number 2. As per IRDA guidelines, Ayush hospital must comply the minimum beds criteria. See, few years before there was no particular criteria mentioned in the regulation. Last year they mentioned a very clear criteria for Ayush, because Ayush is supported by the government of India. You know, the question comes for the juniors, what is the definition of AYUSH? Ayurveda, Unani, like that, you know, Ayurveda, Yoga, Naturopathy, Unani, Siddha and Homeopathy. So the question came few years before and often is coming for juniors. What is that this AYUSH means? So that you please understand the juniors. Seniors, you know that, you must know that. Plus, you should not get confused with the normal allopathic treatment bed hospital criteria, because for allopathic the criteria is different. What is the criteria earlier? 10 beds in rural area, 15 beds in urban area. Now that is also not there. They have changed now. Even for allopathy, that we'll see later. So now recently, last year they have put a criteria for Ayush. All insurance policies must cover Ayush. Number 1. That's a new criteria. Then all health insurance policy should not have any percentage of cover. See, earlier for Ayush only 25% is covered by the insurance companies. Now it should be covered to the maximum sum insured. That is also new criteria. Apart from that, Ayush, already you know, they must be a qualified Ayush doctors, they must be a registered doctors. Then you should have it in a small hospital like allopathic hospital 24/7, and all these things are applicable for Ayush also. But the number of beds is reduced. It is only 5 beds irrespective of rural or urban. That you must know as far as Ayush is concerned. Okay. Now question number 3. The IRDA guidelines on telemedicine stipulates telemedicine. Insurers cannot cover telemedicine procedures. Insurers can cover telemedicine on pilot product basis. Insurers are advised to allow telemedicine, but approval of pilot use required. Insurers are advised to allow telemedicine and no approval of pilot use required. First, you must know what is telemedicine to select the right answer. First, you should know what is telemedicine. Second, you should know what is the regulation. If you do not know both, you will tend to do the wrong and pick up the wrong answer. What is telemedicine? The telemedicine concept came during COVID time. See, people were not able to go to hospital. Even if they have gone to hospital, the continuation of treatment cannot be done in hospital because there were a lot of patients came, there were no beds, so they were asked to get treated at home. So when the patient is at home, he cannot go to the hospital, but how do he express his improvement or his status of health? Suppose it's deteriorating or improving. So you must definitely consult a doctor. You know, once you get a medicine, you cannot simply forget the doctor or hospital. So what they have done, you don't come to the hospital, you be at home, take your cell phone, we will come in the video call, we will talk to you, we will see you physically over a video call, then we will hear whatever your difficulty or whatever improvement, whatever your deterioration, accordingly we will change the medicine or advise or prescription. So telemedicine is something like a video conference, that you need not go to the doctor. Sometimes you have to go to a doctor who is very far away. You would have got treated with a doctor from Chennai or Bangalore, but you are in Coimbatore. How can you every time you can go to Chennai or Coimbatore? So the doctor himself will come forward. Okay, for review, you don't come here. If for review, I'll come on call, by video call. That's called telemedicine. This is approved by IRDA after COVID. Please understand. So there is no need to go after an admission, after a discharge, for a continuation of treatment. A telemedicine is approved. So in that case, you can definitely accept the claim, the bills incurred towards telemedicine. Then, whether it is requiring any file and use or use and file, what is the difference between file and use and file by IRDA regulation? First we have to get approval, then you started using it through your product. That is file and use. But you must get approval first. But sometimes IRDA also said, you don't get approval now, you just use it for few times. for a specified period. That is called pilot products. For a specified period. If you are happy, if it is good for both the customer, the insured as well as insurance company, you come forward approval. That is use and file. So here, as far as telemedicine is concerned, the IRDA regulation says it is allowed, it is accepted, and there is no need to get approval. See, the right answer is D. So approval, no approval of file and use is required. So the right answer is D. Okay, question number 4. Which of the following disease condition that is not covered by standard health insurance policy? Please understand, there is one disease condition not covered by standard health insurance policy. For example, hyperacute disease condition that is insidious and life-threatening. What is this? See, hyperacute means suddenly the patient will get an heart attack. Immediately there will be a block. He has to go and he has to give an angiogram and he has to give an angioplasty. He has to open the blood vessel so that the blood has to pass to the heart so that he will become a normal person. Otherwise he will die heart attack due to heart attack. Or there may be a dangerous life-threatening case where, for example, uterus. In a uterus, if the baby is not developing inside the uterus, the baby is developing outside the uterus. That is called extra-uterine pregnancy or tubal pregnancy. So it is not excluded under normal policy, even though the maternity-related cost, infertility, fertility, okay, maternity, all normal standard policies excluding. Only some customized policy or group policies are adding maternity benefit. But the question is standard health insurance. But standard insurance, is it not acceptable in case of acute diseases? You have to understand what is acute, what is hyperacute, what is chronic acquired, what is chronic existing. These 4 words you must understand, then only you can easily pick up whether the claim is payable or not. Please understand, if the word comes hyperacute, that means it is a life-threatening. It needs immediate attention by a medical professional, otherwise the patient will die. For all kind of such conditions, automatically covered under our standard health insurance policy. What is insidious? The disease which is there in the body may not be known to the patient. That is called insidious. It's called asymptomatic. It is not known to the patient. Suddenly it will come. Chest pain. Immediately you are diagnosed as having a block. So that is insidious. He is not aware till yesterday, but only today you come to know. That is called asymptomatic. And if it is not done immediately, his death is imminent. So life-threatening. So such cases are automatically eligible for claim under standard health insurance company. Acute diseases. What is acute diseases? The disease will come and it may require, may or may not requiring hospitalization. If it is not requiring hospitalization, claim will not be settled because our health insurance policies are hospitalization policies. Unless otherwise we admit not less than 24 hours, the claim cannot be settled. So in an acute disease where hospitalization treatment is required, for example, common cough and cold. You take common cough and cold, we will sneeze, we will have cough, but we will take the tablet at home. That is not payable by standard health insurance policy. But if you are not able to control the cough, if you are an aged person, if you are a senior person, if you are having morbid condition like diabetes or some other complication, during winter season, very serious winter season like December, this end of the month, the cold, the environmental temperature will be much colder. These kind of people will definitely get into bronchitis or bronchopneumonia or pneumonia or pneumonitis, the lung infection. So they have to definitely get admitted even though it's acute disease. Once they get admitted in the hospital, that claim is payable till it's discharged. It may be the discharge may happen after antibiotic treatment after 1 week or 10 days, you'll get discharged. So that expenses incurred in hospital even for acute diseases, but provided if it is hospitalized, that is payable. So what is acute disease? Acute disease is a condition that is an abrupt onset. Suddenly fever has come. I was having only cough and cold, but today I am having very severe fever. So they are taking me to the hospital. So abrupt onset, and after treatment I can immediately recover. Within 6 days I'll get discharged. That is quick recovery. So this is Payable or not, as I told you, if it is hospitalized, it is payable. If it is not hospitalized, it is not payable. Chronic disease. What is chronic disease? Chronic disease is the one which is already there in our body. It could be before taking policy or it could be after taking the policy. If it is before taking policy, it becomes a pre-existing. Please understand. If it is before taking the policy, it is a pre-existing. If it is after taking the policy, it becomes acquired. Acquired means it came after the policy. But if it is after the policy, but after 30 days of waiting period, the claim is payable. If it is acquired within 30 days of waiting period, it is not payable. So please understand the question. What is the question? Which one of the following disease conditions is not covered by standard health insurance policy? Here the answer is C. This is a little complicated answer. 2 and 4, 3 and 4, 3 and 4. Here you must know hyperacute diseases is covered. So 1 is covered. Wherever 1 is coming, that is covered. Acute diseases, okay, provided hospital. Chronic diseases existing before policy is not covered because they have to. Becomes a pre-existing. Maybe they have to wait for a waiting period. Chronic disease that acquired, that is covered. So what? So here 1 is covered. Chronic disease acquired, that is covered. 4 is covered. Then here you see 2, acute condition that is abrupt onset and quick recovery. Yeah, if it is hospital, that is covered. So out of this, which is the right answer? The question not covered. So what is chronic disease condition existing before the policy is not covered by standard because it comes under the exclusion. Or they may have to wait for a long period of waiting period. Okay, so the answer is 3. I think you are able to understand here. We will go to the next question. With regard to health insurance coverage, pick up the odd one out. What is odd one? Out of the 4, 3 are somehow relevant to each other. That means it could be covered or it may be excluded. The 1 is opposite. If the other 3 is covered, the other 1 is excluded. The other 3 is excluded, the 1 is covered. So that way the question is designed. So what you have to know? With regard to health insurance coverage, pick up the odd one out. Pacemaker, prosthetic leg, cochlear implant, intraocular lens. So what you must know for examination point of view, these are all add-ons over our body to make our life living and healthy. So pacemaker is the one that makes the heart to function. When the heart is not having enough electricity, because God has given you enough electricity to make the heart to work, lub, lub, dub, lub, dub, like a pumping, like a pump, shrink, enlarge, shrink, enlarge. So it needs a battery. So we don't have a battery, we don't put a battery to make our heart to work, but God has given a battery inside our body, that is electricity. That electricity is not enough, the battery is depleted, the battery is gone. Definitely we have to make a man-made battery, that is called pacemaker, that is given to the human body. How it is done? It is either it is done 2 ways. One is with a lead, that means connected to the heart, or it could be put into the heart. So if they can put into the heart also, that is internally they will place a pacemaker inside the heart, or they will keep the pacemaker just below your collarbone, that they will connect through a lead to the heart. So it is actually placed inside also, pacemaker. Prosthetic leg, it is not put inside the body, it is added to the body externally. Suppose there is an amputation because of accident or because of diabetic, there is an amputation, they have to add an artificial limb. The artificial limb is called prosthetic leg. So it added to external body. Cochlear implant. Cochlear implant, you see here, this is if somebody has got damage the ear due to an accident or due to a disease, and they have to hearing aid. Normally hearing aid will be kept over the ear, that is externally, but cochlear implant is inside the ear. So that is also going inside. Intraocular lens. What is intraocular lens? This is, you see here in an intraocular lens, suppose a cataract operation happens. They have to remove the God-given lens from the eye. They will put a man-made lens inside. That is intraocular lens. So here, these all added to the body whenever it is needed. When a cataract operation, intraocular lens. When a deafness occurs, cochlear implant. When a leg is removed, prosthetic leg, that is amputated, that's an artificial limb. When heart problem comes, the claim is payable, the pacemaker. So here, which is odd one out? You see here, cochlear implant. Why? You must understand. How to understand easily? Sir, if somebody is asking something, we are not doctors, we are not medically knowledgeable, how can we pick up the right answer? I make you to understand very easily. Please understand, anything fitted inside the body are all payable. Please understand, anything fitted inside the body are all payable except cochlear implant. Anything fitted inside the body. Pacemaker is going inside. Okay. Cochlear implant going inside, but it is accepted. And intraocular lens is going inside. It's payable. Then anything fitted over the body are all payable except anything fitted over the body are all not payable except prosthetic leg. Because the prosthetic leg is an artificial limb attached with the amputated leg. So you understand, here pacemaker can be covered because it will be fitted. Prosthetic is not an exemption, even though it is outsidely fixed. Pacemaker is inside going, it is covered. Prosthetic leg, anything fitted over the body are all not payable, but prosthetic is payable. So claim is payable in case of pacemaker, claim is payable in case of prosthetic leg, claim is payable in case of intraocular lens because it's going inside the body, but claim will not be payable even if it goes inside the body because cochlear implant is an exemption in case of health insurance product. So please understand, to make you to understand very simple, always remember, anything fitted inside the body are all payable except cochlear implant. Anything fitted over the body are all not payable except prosthetic leg. Now you'll be able to pick up the right answer what I discussed here. Okay, now we'll go to model question 6. With regard to IRDA standardized health insurance and PA insurance coverage, pick up the odd one out. See, they say standardized product. So there are 4 answers. So all the 4 answers may not be having standardized product of IRDA. There is one answer is having normal product which you have to pick up because that is the odd one. So Arogya Sanjeevani is a standardized product. Saran Suraksha Bima is a PA policy standardized by IRDA. So this is not the odd one because Corona Kavach and Corona Raksha also IRDA product, standardized product. So this is also not odd one because these are all applicable. Then Corona Raksha and Mashak Raksha is vector disease, that means mosquito bite and insect bite disease, that is also standardized product by IRDA. So A, B, C, D, all are standardized, no doubt. But what about C? Health insurance gold and Mashak Raksha. See, Mashak Raksha is a standardized product, but health insurance gold is not a standardized product. United India may have a different gold, New India may have a different gold, but gold name is common and age group is common, general coverage is common, policy terms and conditions are common. Coverage exclusion may not be same or may be same, but they are applicable to all 4 companies. But this is not an IRDA product. So this is an odd one out. So you have to select C. You are able to get my point? Okay. Model question 6. Now question number 7. Rajan is covered by health insurance policy and the premium is being paid on monthly installment basis. Please understand. He is covered by a health insurance policy. Premium is paid by monthly installment. Here you must know one thing, my dear friends. Whether we can pay premium installments in health insurance, what are the policies where we can pay installment premiums in insurance sector, general insurance sector, that you must know. Because otherwise, you all know 64 5B violation. 5 is a Roman letter. Some people will say BB. No, it's 5B. 5 means a Roman letter. So 64 5B, what it says, premium must be paid in advance. So installment basis not acceptable. That is in our general insurance sector policy. But there are 2 exemptions where you can pay premium on installments. What are the 2 policies where you can pay premium on installment? One is engineering project insurance. In a project insurance, stage by stage you can pay the premium. Next one, in miscellaneous, installment premium is possible in case of health insurance. That is why IRDA says you can get installment basis, monthly basis or quarterly basis, half yearly basis or annual basis. That provision IRDA has created. So here the question is, he is paying on monthly basis. Okay. The next installment premium is due on 1/12/25. This question is for seniors. Please be with me. He could pay it only on 12/12/25. Please. The premium due is for the monthly installment is 1st December. But he paid the premium only on 12th December. Okay. He is hospitalized on 7/12/25. Got discharged 10/12/25 and incurred rupees 14,000 towards hospitalization for acute gastroenteritis, that is food poisoning. Whether the claim is payable. You see, the claim cannot be considered as the policy is not renewed in time. The claim cannot be considered as hospitalization occurred during the grace period. The claim can be considered as the installment premium paid within the grace period. Claim can be considered on non-standard basis. See the answers? You will be, if you are thorough the subject, you will never get confused. They try to trigger your mind. If you know on a monthly installment basis, the grace period is what time? On an annual installment basis, what is the period of grace period? For a monthly installment basis, the grace period allowed by IRDA is 15 days. For an annual premium based basis, 30 days grace period. What is the grace period? Grace period actually, normally in a normal what we will do, annual basis, we will take over all the benefit accrued in the previous policy when they renew the next year in an annual basis. But any claim comes during the annual grace period, we will not settle the claim. But there is an exemption in case of installment premium because you are allowing the customer to pay on installments. So there is no break in the period. So in that case, how many days you are allowing for installment basis? 15 days grace period. So here, when did he pay? Within 12th day. So there is a very well available grace period is there. Even before expiry of 15 days, he paid on the 12th day. So during the grace period, already he has paid the premium in time because he has utilized the grace period. But installment basis, if somebody hospitalized, because he is allowed to pay the installment, there is no break in the payment of premium, claim must be considered. So the right answer is claim can be considered as an installment premium paid within the grace period. So now you understand, the grace period is 30 days for annual policies, but break-in will not take over hospitalization. But here you see the grace period installment even paid within the grace period, and definitely the hospitalization could be considered. That is a new IRDA norms. Okay, now coming to common template. So what I did to you now, I just triggered your mind. Until this slide, till the 7th question, till what I discussed with you, now you would understand where you stand in health insurance knowledge. The way I discussed with you, the way I triggered your mind, now you will be able to understand how best of knowledge you got in health insurance as far as IRDA regulation and the practice of health insurance. So if you learn something new, please remember. And if you already know whatever I discussed, that you always keep remembering that because that's all important for an examination point of view. Now coming to the common template of R4 companies. Here there will not be any variation, but you must understand what is what. Otherwise you will not be able to pick up the right answer. So health insurance policies are covering all signs of medicine in India. There is no exemption. We do cover allopathy, Ayurvedic, Unani, Siddha, yoga. You should not say yoga, you should say yoga, naturopathy, because naturopathy is also covered. You don't take why is only yoga, it's yoga, naturopathy. Okay, then it all covered by Indian health insurance companies. Science of medicine, these are called science of medicine. Okay, allopathy and Ayush. Then what type of coverage we give in health insurance product in India? Hospitalization. So we fix a norm. What is the norm we fix? Not less than 24 hours hospitalization in case of regular hospitalization. In case of daycare, that is different. They can get admitted, they can get discharged on the same day. But we have got some specific coverage for daycare. We cannot cover everything under daycare. That you know that. That we'll discuss also later. What is domiciliary? Domiciliary means there are certain time the patient cannot be moved to the hospital. He has to take the treatment at home. In that case, the domiciliary coverage we are giving. What is domiciliary? What is coverage? What is not covered? All these things we'll see later. Daycare, already I told you. Due to the advance of medical technology, and we have given some, because we have got a very well developed machines, well developed tools. With that we can immediately take care of the patient, and we need not put the patient in bed. We can discharge in the same day. There are some days diseases are covered under that. They are called day care. Okay, it should be treated as hospitalization, even though it is not hospitalized. Critical care. What is critical care? There are some diseases called life-threatening. If somebody is diagnosed that he is having that particular disease, his life is numbered, days are numbered. That means he will not be live for a long period. He may be living for few months or few years. That's called critical care. For example, brain tumor. You take brain tumor, both kidney failures, under dialysis. Okay, then multiple sclerosis. There are many diseases are there that you can see later. Then specific illness policy. These are the way how do we market the health insurance product. What are the specific illness? There are some illness we have a specific policy. As I told you, mosquito bite, the vector disease, that policy is there. Corona policy is there. Corona Raksha, Corona Kava policy is there. So these are called specific disease illness policy. Travel policy. There are different type of travel policy. You may be knowing only OMP, Overseas Medical Leave Policy. IRD has come out with another travel policy called domestic travel policy. Because within the India, people always travel to different pilgrimages. They go to Kasi, they go to different religious temples, whether it's a Christian or a Muslim or Hindu. So they often travel to the spots, so that they need some kind of insurance within domestic. That's called domestic travel. They go abroad, that is called overseas, so that travel. Apart from that, we do have also government schemes. I already told you, we are going to talk about only central government schemes. So these are the way the health insurance product are involved. Now how do we sell the product? We sell the product individually. We sell the product by floater basis. We sell the product by group. We also have a standard and specific risk cover. Standard cover means we have a regular policy. Specific risk cover means we have a critical care illness policy, or we have a corona policy. Like that, we are also selling the product. What is individual? A proposer must be an individual. He can take for him, he can take for his dependent spouse, he can take for his dependent children, he can take for his dependent parents. Not only his parents, but his wife's parents also. So parent-in-law also can be covered. See, this all comes under individual. So as far as individual policy, there is some discount, more than 1%, and they can have a family discount. Floater policy, it is nothing but it could be given to individual also, it could be given to floater also. That means one sum insured should be, here individual policy, the sum insured may not be the same for everyone. The father might have been the proposer, he would have taken for 2 lakhs. The wife may be a dependent, she would have taken, for her, he would have taken 2 lakhs. For her children, he would have taken only 1 lakh. For your parent, can he take more than the proposer sum insured? No. In an individual policy, the dependent sum insured cannot be more than the proposer sum insured. That is also important for an exam. For example, for a simple question they may be asking like that. For a complicated question they'll put the sum insured, they'll ask you whether whether the underwriting is correct or not. See, for example, I am an individual, I am covered for 2 lakhs. My wife I have covered for 2 lakhs. My children I have covered, 2 children each I have covered for 1 lakh. I have got a dependent father, I have got a dependent father-in-law. Can I cover, because my father and father-in-law are very 60 years old, they are more prone for diseases, can I cover for 5 lakhs? No. It could be the same what I have taken for myself, or it could be less than what I have taken for myself. Otherwise, there is an adverse selection. Intentionally I am taking more cover for my father-in-law, thinking that I will be making a claim. So that is not allowed, it's an adverse selection. So please understand, in individual policy restriction. Floater, same sum insured for all. So either everyone can share or one can be utilized, the policy will be over. For example, I have taken 5 lakhs cover for my family. My family consists of myself, my wife, my children. I can use for myself the entire 5 lakh, or I can use for 1 lakh for my wife, or I can, even the balance of sum insured can be shared for any one of them, but overall the total sum insured cannot exceed more than 5 lakhs. That's called floater policy. Group, you know very well, a group must be identical, it should be a common purpose. A group should not be formed for the sake of health insurance. See, you would have seen some people will only to give a health insurance they will create a group. No, that is not allowed as per IRD regulation. Already existing group, members of a club, okay, you can give, or the person who is having a credit card, all the credit, the bank which is issuing credit card, they want to have a group insurance, they can take. They are identified with a common norm. There should be commonality among all the people inside the group. That's more important. You should not create a group only for the sake of getting health insurance. There should be an existing group. For them only you can give group policy. Another important point in IRDA regulation, earlier group has got some number, minimum 100 people. No, now even 7 people is considered as a group. So remember, 7 people is the minimum number to get a group insurance policy. Okay, then coming to the, how do we cover the benefit? We either issue an indemnity policy, we issue a benefit, fixed benefit policy, and we also give excess of loss policy. What are the policies we are selling? For example, a person has taken a policy. Whatever he has actually spent, barring the deductibles or barring the sublimits, the balance will be sent to his actual loss. For example, I have taken a platinum policy or a senior citizen policy. If there is a co-share, that will be taken away. If there is a sub limits, that will be taken away. But whatever I spend according to the policy condition, room rent, doctor charges, okay, then medicines, diagnostics, all will be indemnified. That means without reducing, as per the policy condition, if everything done, without reducing anything, will be paying the actual amount, that is called indemnity. But we will not pay the entire sum insured because he made a claim. For example, I have taken a policy for 5 lakhs. I am admitted in a hospital for 1 lakh. But there may be some extra charges like registration charges or TV charges or some attended food. That will be taken away by the insurance company because that is not connected to the patient. Removing that, all other part, if it is within the terms and conditions, I would have got a settlement of 80,000 or 90,000 out of 1 lakh I have spent. That is indemnity. But I will not get the entire 5 lakhs. What is benefit policy? Benefit policy is specified illness. If the particular person has come across such disease and is there more than the specified waiting period. What is the waiting period? 90 days. It is not 30 days in case of benefit policy. For example, critical care illness. If somebody is identified he is having a life-threatening disease, he is having a brain tumor, but he is alive more than 90 days, he has already taken a critical care benefit policy. So after 90 days, any time if the person is no more, whatever assured, that's called sum assured, it is not sum insured. So the amount will be paid to the nominee. That is called benefit policy. What is fixed benefit? Even in indemnity policy or in a benefit policy, some fixed benefit will be also there. You would have seen hospital cash benefit for 15 days, this much. So if somebody is there for some, in a hospital, and extra expenses which is not covered, for example, you would have taken a taxi, you would have spent something for the attendant, that's all not covered by a standard policy. Some small amount will be given as hospital cash benefit, that is based on deductible, not more than 15 days, for 10 days or 15 days, whatever is mentioned in the policy. What is the percentage of the sum insured is mentioned in the policy. For example, 5% or 0.5% or 0.2%. I don't want to talk about percentage because percentage all varies all the 4 companies. But understand the logic. There is a specified percentage, there is a specified period. How many days? 15 days or 10 days. Specified period is there, specified percentage is there. And for that, during the period of hospitalization, some benefit will be given without deducting anything as a benefit, even along with the indemnity policy or even along with the benefit policy also. For example, in case of corona policy, there is some fixed benefit is also there. We will see later. What is excess of loss policy? A loss is occurred, but that loss, for example, I can manage only up to 3 lakhs and my loss is 5 lakhs. So 3 lakhs manageable. More than 3 lakhs, there are 2 lakhs I can't manage. So excess of my loss. The primary loss, the excess of primary loss. So there is another loss has occurred because you are not able to manage more than 3 lakhs because you would have got a 3 lakhs policy or you would have a fund at home, self-fund, you can manage up to 3 lakhs because you have got some savings. But more than 3 lakhs, suppose if I got admitted in hospital, my hospital expenses has become 5 lakhs, how I am going to manage the extra 2 lakhs? There, one policy comes and helps you. That policy is called super top-up policy. So the super top-up policy is also called excess of loss. It can be also called stop loss policy. your excess of loss could be stopped if you had opted for a super top-up policy. So, example of excess of loss, super top-up. Example of benefit policy is critical care. Example of fixed benefit policy, in case of benefit policy, it's called your corona policy. In indemnity policy also, some policy you have got a cash benefits, hospital cash benefit. I don't want to tell you because you understand, because there are difference between among the 4 companies. So, this is all the way that we all market the products. So, now you understand what is the indemnity, what is benefit, what is fixed benefit, what is excess of loss. Okay. Now, in excess of loss, earlier only United India had the super top-up, but now all the 4 companies are having super top-up. So you must know what is super top-up, what is the threshold in super top-up, how the claim would be settled by the super top-up policy. That we will talk in the forthcoming slides. Okay. Here I leave the slide. Waiting period. When you read about waiting period, you should not always think 30 days. 30 days waiting period is for standard health insurance policies. But there are some difference. For example, 15 days waiting period is there. Which policies 15 days waiting period is there? Your corona policies have got 15 days waiting period, that you must know. Some of the standardized health insurance policies also has got 15 days. Your mosquito bite, your vector disease policy has got 15 days waiting period. So, or 30 days waiting period. Which one? We will see later. But we must understand, waiting period means it is not only 30 days connected to a regular standard health insurance policy. There are some variation. For example, critical care illness, your waiting period is 90 days. It is not 30 days. For a corona policy, your waiting period is 15 days. So when you read about waiting period, please recall all the connected facts, all the connected subject matter. Then only you will have a calm mind when you try to pick up the right answer. Otherwise, you will get confused. Okay. Coming to grace period, I already told you, grace period is not always 30 days. It could be also 15 days in case of installments. Okay. Coming to loading. What is loading? See, IRDA, earlier what we used to do, when somebody is making lot of claim, we used to load at the time of renewal. As we like, some insurance company load 200%. Some insurance company will like load 300% because they don't want to make the customer to renew the policy, and they will push the customer to go to some other company. Now IRDA has come out with a policy, you cannot load based on adverse claims history. Loading has got 2 parameters. One is called adverse medical history, another one is called adverse claim history. What is adverse medical history? While underwriting itself, the customer or the insured has got morbid condition. What is morbid condition? He must be having a blood pressure, he must be having a diabetes, okay, he must be having excessive cholesterol, hyperlipidemia, we say in medicine, hyperlipidemia, excessive cholesterol. So he is more riskier than normal person. So you can add loading, maximum 30% loading, along with the premium you can load. So IRDA allowing you to do loading, provided if you have got an approval from IRDA, at the time of launching the policy, you must have got approved by IRDA, how much you are going to load, for which you are going to load, for which adverse medical history you are going to load, diabetes, blood pressure, excessive cholesterol, or only one or all the 3, that you should get approved. Once you get approved, only that much of loading, maximum of 30% only you can load, that is allowed if it is approved. But if a claim comes, you should not try to chase away the customer to go to another company, making him to pay more premium. That is called adverse claim history loading. That is prohibited by IRDA now. You cannot load. Please understand. Okay. So here I already completed what is hyperacute, that is life threatening. What is acute? I already told you. Needs hospitalization is covered. And chronic, what is pre-existing, what is acquired, I already covered. The last one is any one illness. That is, what is any one illness? See, for example, I have taken a policy from you. The policy is expiring on 31st December. Please be with me, then only you can pick up the right answer. The policy is expiring on 31st December. But I got admitted in a hospital on 30th December. I am undergoing a treatment there, and I got a gastroenteritis, that is a severe food poisoning or a typhoid, whatever it may be. Then I got admitted. I got discharged within a week. When I got discharged during the month of January. My policy is already expired on 31st January. I got admitted on 30th January. So the claim occurred during the course of the policy. So my claim is payable. Number one, you have to understand. But I got discharged on 6th of January after 6 days. That doesn't mean, because claim has occurred during the course of the policy, so the insurance company has to pay the claim. Fine. Now, at the time of discharge, the doctor says you already have a very damaged stomach. You have a lot of infection in the stomach. Now we have cured the stomach. But that doesn't mean that you are fully cured. When you go back, you should not eat spicy food. You should not take biryani and all other things. You should control your diet. Otherwise, the disease can come again. Be careful. He's warning and it's making me to go home. I'm coming back after 6th January, but I forgot to renew the policy. Please understand, I forgot to renew the policy. The policy is no more existing, but I came back home after discharge. But doctor said not to eat biryani or spicy food. I was tempted by biryani smell and I ate biryani after 5-4 days after coming back. Then again my stomach got troubling me. Then fever has come. Again I got admitted in the hospital. Doctor shouted at me, I told you not to eat, but still you have taken. There is a relapse of same illness. The same relapse of typhoid or a relapse of same illness, it has come. Now I have to take another course of treatment, and he is admitting me. At the time of second admission, I am not having any existing policy because the previous policy is already expired on 31st December. Suppose the second admission, within 3 days I got cured and I spent nearly about 25,000. My total sum insured is 1 lakh. The first admission I got reimbursed for 50,000 rupees and the balance of 50,000 rupees is still there, but the policy has not been renewed. The second admission has occurred after the expiry of the first policy. Then I incurred again 25,000. I'm going back, I'm submitting the bill to the insurance company, whether the insurance company will pay the claim or not. Here you have to be very careful because the question may be coined like that. Unless you understand clearly what is any one illness. Any one illness is nothing but it is an illness that can come back again. Same illness, not a new illness. Suppose I got admitted for typhoid, but after some time, within 45 days, I got malaria. If I go and get admitted in the hospital, but there is no policy, claim will not be settled. But same illness occurring within 45 days, but the policy has not been renewed, but the balance of sum insured there, I am eligible to get the claim under any one illness class. So in this case study, wherein I got discharged in the second admission, I go back, but I forgot to renew the first policy, but still I am eligible to get a claim under any one illness class because it is occurred within 45 days and there is a balance of sum insured there in the previous insurance policy, so I can get back the 25,000. So that is what you have to understand, what is any one illness class. The question may be for a junior, what is the number of days for any one illness class? They will maybe 60 days, 90 days, 45 days, 15 days, but you have to select 45 days. For a senior, they may tell a story like what I told you. They will try to find out whether you are still able to understand. For a relapse of same illness, the person is eligible. Suppose in the story they put for another disease, he got admitted without renewing the policy, you have to select the claim is not payable. That's what for seniors. Okay. Now coming to salient features. What is salient features? You know what are the heads in the health insurance? Room rent. Okay. Room rent is there, doctor fees is there, specialist fees is there, and diagnostics or X-ray, MRI, and any other equipment used. Then other thing, medicines. Okay, all are there. So what is covered, what is not covered, this all we will see later. But there are heads. Here, what is more important? Room rent. General applicable, what we say normally 1% of the sum insured is applicable room rent, and 2% of the sum insured is applicable for intensive care unit. That's a common for all 4 companies. And sometimes there may be a variation, but common for all 4 companies, 1% of the sum insured in a regular room rent, and in case of ICU, it's a 2% of the sum insured. Suppose I have taken a policy for 1 lakh. I got admitted in a hospital where the room rent is, there are rooms for 1,000 rupees, there are rooms for 2,000 rupees, there are rooms for 5,000 rupees. But I took a room for 5,000 rupees, I make a claim. How the insurance company will settle the claim? Since you are eligible for a room rent of 1% of sum insured, you are eligible only 1000 rupees per day. Even though I spend 5000 rupees per day, in total of 5 days, 5 into 5, 25,000 I spend, but what I am eligible, 1 into 5, only 5,000 I am payable. So only 5,000 will be considered, the balance 20,000 will not be considered. That is as per the room rent class of a regular policies. Please note it down, regular policies. And accordingly, if the hospital has got a norm, for example, if the person is admitted in a luxury room and all other charges like doctor fees, okay, diagnostic fees, medicines they cannot charge excess more than MRP, but the diagnostics, equipments used, doctor fees, specialist fees, they can also raise up, they can also increase it, enhance, because this man is a rich person. He is enjoying 5,000 rupees room. He is able to pay, is affordable. So what they will do? The same, accordingly, proportionately, they will increase the cost of the other heads also under the section of heads. For example, if you are eligible for 1,000 rupees, but you are taken a 5,000 rupees, there is proportionately you increase nearly about 4 times more, almost 4 to 5 times more. So if you are taken 5,000 rupees room and you are also incurred expenses in other heads like doctor fees and your specialist fees, equipment fees, there also they will be enhancing the amount because you are affordable, you are able to pay, then more. So in hospitals where they charge you on proportionate basis based on room rent, the other heads, that will not be payable by our regular insurance company. There are some hospitals, if they declare that, sir, room rent is independent of other charges, whether they take a normal room or an excessive room or a suite or a luxury room, the other heads are standardized charges. We will not be proportionately enhancing the charges. If they give a declaration, the insurance company is not supposed to make proportionately reduce the charges in other heads also. This is also practical norms given by IRDA. And there is one hospital is there, and that is a specialty hospital wherein you can take treatment only there. For example, brain tumor case where there is a, they only handle brain tumor case. That's specialty hospital where the minimum room rent is 2,000 rupees. The person is eligible for 1,000 rupees, but he has no other option except to take the minimum room rent of 2,000 rupees. There also the hospital gives a declaration that it's a specialty hospital, we don't have any room for 1,000 rupees, the minimum room rent is only 2,000 means there also the deduction should not be made by the insurance company. So there are some relaxation under room rent, but generally room rent is based on 1% of the sum insured, that you must know. Coming to age, in an age group, see normally age at entry and age at exit, this is what we talk about health insurance. Age at entry means a child, the proposer is more than 18 years old, and if a child is there, and a child from 90 days onwards, from 3 months onwards, they can add. But at normal age, simply only a baby cannot be insured alone, anything. So the age at entry is 18 years. But if any one of the proposals is covered, a dependent child at the age of 3 months onwards can be covered. That is age at entry. Age at exit. What is age at exit? Normally, age, what we will do, we have designed the policy up to 65 years. After that, we will go on extending the policy, renewing the policy as long as the customer is alive. Now there is no limit of age at exit. As long as he is alive, he can continue the policy. Now, again, we have got some conditions. For example, before getting into the policy, he must be below 65. After 65, we cannot make him to get into a health insurance policy. These norms were existing earlier. Now IRDA come out with the new norms. You should not say because he has crossed 65 and he is entered into 65 or 68 or 69. You should not deny that he is not eligible for any health insurance policy. But accordingly, you have to design a policy for such person who is more than 65 years old. So now you must understand the age at entry is not 18 to 65. It can be anything above 85. Even at the age of 70 also, he can enter into the health insurance policy, and such policy should be definitely created by the insurance company. That's what the IRDA new norm says. That's what you have to understand here. So here clear. Sum insured, it varies. You know, it could be a multiplication of 50,000, it could be a multiplication of any amount, but minimum 50,000, minimum 1 lakh, depends upon the policy. The sum insured is the amount wherein the indemnity amount will be settled. Sum assured is the amount where the benefit policy, whatever the amount assured, if the patient come across such kind of critical illness, life-threatening, the amount will be totally paid. That is the difference between sum insured and sum assured. And period of insurance, normally all health insurance policies are annual or more policies. Wherein more policy, long period policy, I'll tell you later, but generally annual policy. But there are some policies 3.5 months, 6.5 months, 5.5 months. Short period policy also available. For example, in Corona policy, these kind of policies also available. That's what. So hospital, it has got a definition. It must be having how much of bed. It must be a registered hospital. First, the local authority. And the local authority means, if a corporation means, it must have been registered with the corporation or a municipality. If it is not a registered hospital, it must have minimum number of beds. Earlier, it was 10 beds for a rural, 15 beds for urban. Now what they said, 10 inpatient beds in place having a population of less than 10 lakhs people. And at least 15 inpatient in all other places. So now what they did, they made on population 10 lakhs below and 10 lakhs above. If there is no classification of rural and urban. If what they mentioned, if the population is below 10 lakhs, the minimum bed required 10 beds. If the population is more than 10 lakhs, and it must be 15 beds and more. That's the changes occurred in the regulation. Okay. And nursing home is different. Nursing home will not have 100% 24/7 hospital operation theatre, nothing there. So anything admitted in a nursing home will not be paid. Anything admitted in a hospital which has got 24/7 Medicare, a qualified medical doctor, a qualified nurse, all are there, and there must be an operation theatre, then only it comes under hospital, where if the admission occurs, then only the claim is payable. Otherwise, it is not considered as hospitalization, exempting the daycare, where it would be considered because of advancement of medical technology. Provisions, family discount, you know, we give normally family discount to the dependent children and dependent people. Normally it is 5%, okay. There may be some variation, but standard is only 5%, extra 5% for the first 2 children. And more than that, we will not give the discount if the more than 2 children. In a regular policy, there are policy allowing you any number of children, government policy. There are policy allowing you only up to 3 number of children in case of micro health insurance policies. But in standard health insurance policy, we allow only 2 number of children. That doesn't mean the third children cannot be covered. Please understand, the third children can be covered, but the discount cannot be applied. That's what you have to understand. Cumulative bonus, it has a slab. Every year, if they are not making a claim, the 5% of that sum insured will be going on added. So maximum 50% of sum insured will be going on if he is not making a claim. So if he is not making a claim for more than 5 years, every year 50, 50, 50, every year 5, 5, 5. So like 10 years, so maximum 50%. So more than 50% cannot be added to the sum insured. Suppose if there is any claim comes, in motor policy what we do, in motor policy, you would accrue some bonus. But if you make a claim, everything will go down to 0. But now it's not like that. In health insurance, the way you increase the slab, the way you must reduce the slab. Suppose you makes a claim, one claim, in 1 year of in a year policy, you should decrease only one slab. You should not completely nullify the entire bonus what he has earned over the years. That's a new regulation that has come in case of cumulative bonus as far as the new regulation is coming. Health checkup, you all know, after 3 years, 4th year, if he has not made any claim, it is a benefit given to the customer, and he can go and have a general medical checkup, a preventive medical checkup, and it is only a loss minimization measure by the insurance companies. So 1% of the sum insured of the will be reimbursed, provided that he has incurred and he has submitted the bill for preventive checkup. The amount is not paid to him in cash. The amount is reimbursed if he has incurred by subjecting himself for some health checkup, like diabetic blood sugar test, or your heart, suppose there is something is there, so they would have gone for some heart checkup, something like that. No, it could be anything, X-ray, MRA, CT scan, okay, whatever it may be, whatever you have spent, maximum is eligible 1% of the sum insured, and provided he has not made any claim every 4th year. That's what cumulative bonus. Okay, tax benefit. So whatever premium he is paying by way of any means other than cash, by way of any means, online payment other than cash, he is eligible to get a certificate. Based on the certificate, he can avail a deduction under taxable income. He cannot totally deduct the amount what he paid as a premium. He can deduct under taxable income. That's what you have to understand. That we will see what is the amount he is going to see later. Science of medicine, already I told you. Waiting period, I already told you. And hospitalization requiring minimum 24 hours, I told you. What is pre-hospitalization and what is post-hospitalization? Suppose a person has not got hospitalized, he is getting treated, but within 30 days, he has been advised to go get into hospital. He is having stomach pain, he was treated for an ulcer, but later he was found he is having appendicitis. The doctor is advising him to get admitted in hospital. So whatever treatment he incurred, he subjected himself before getting to the hospital, that is called pre-hospitalization. If he has not got admitted in hospital, that is not called pre-hospitalization. If it is admitted followed by outpatient, he is treated as outpatient, but followed that he has got admitted, warranted admission for a surgery or further treatment, that is called pre-hospitalization. That is maximum of 30 days. What is post-hospitalization? He got admitted, he got discharged, and he has come back home, but some medicines he has to continue. It could be for 1 month, it could be for 1 week, it could be for 2 months, it could be for 6 months, it could be for lifelong. But whatever it may be, once he got discharged, at the time of discharge, doctor is prescribing a medicine to continue after discharge, and up to 2 months, that is 60 days, whatever expenses he is incurring, he can medical expenses, including the medicines he has to take, that will be paid under post-hospitalization benefit. So pre-hospitalization means before admission, but he must have got admitted. Post-hospitalization, after admission, discharge, but he can have maximum of 60 days. But general class for all the 4 companies, the liability of the insurance company under this case, both together, please understand, not each, both together under pre and post, maximum of 10% of the sum insured and not more than the 10% of sum insured. Not 10% of pre-hospitalization, not 10%. Both together, the company can reimburse not more than 10% of the overall sum insured under this head. Then any one illness, I already told you, that is a continuous period of illness or relapse of illness within 40 days. Okay, so this is also over. Now, types of hospital. Primary care hospital, secondary care hospital, tertiary care hospital. What is primary care hospital? Where the consultation is carried base level. Just they will go, they will give some paracetamol tablet and they will say you come take 1 or 2 days, if there is any other problem you come, we will suggest you in another hospital. So primary care hospital is normally there in the villages. You would have heard about primary medical centers, health centers. Primary health center, PHC, they will say, primary care. There will be a minimum number of treatment will be there. That is very basic. Secondary care, there will be it is better than primary care. There will be some single specialty. They may be doing some surgery, maternity care, they will give only for maternity care. Like that, they will have a secondary care. Exclusive for women, they may have a hospital, something like that. Tertiary care, it's a full-fledged hospital. It could be a government hospital, it could be a corporate hospital. All type of treatment, multi-speciality. Okay? Multi-speciality. Here you secondary care, it could be a cancer hospital, it could be a maternity hospital, it could be a gastroenterological hospital, it could be a nephrology, your renal hospital. But here it's a multi-speciality, tertiary care. So we do cover all these things provided they get admitted in a hospital. Okay. What is network versus PPN? Because this is more important. As an insurance company, we practice cashless through TPA. What is TPA? What is the regulation? How do we practice? We have 2 different ways of practice. One is called network, empaneled hospital. Another one is we use PPN, preferred provider network. What is network empaneled hospital? Where cashless facility is provided between the TPA and the hospital. and different TPA have different rates with the hospital for same procedure. See, the network hospital will be managed by the TPA. They will talk to each hospital, they will go to each hospital, they will negotiate. Sir, if my customer come and get admitted for piles operation, and if the claim is eligible, or if my customers come admitted for a very serious acute infection, pneumonia, this much you should charge for my patient, not more than that, and this much of holiday number of days you can keep. Unnecessarily you should not keep this patient in your room. Something MOU they will put. That is called empaneled. It's between the TPA and the hospital. So network hospital is between the TPA and hospital. There will be an understanding, MOU will be there between the hospital, and rates will be as per the understanding. Rates for, but that doesn't mean A hospital, whatever agreed by A hospital must be agreed by B hospital, because A hospital may have a different infrastructure, B hospital may be having a better infrastructure, so the rate may be different, but the selection of hospital depends upon the patient. If the patient likes to go to B, that rate will be applied. If the patient prefers to go to A, that rate will be applied. So rate differs to different hospital under network empaneled hospital by TPA. That you must understand. What is PPN? Preferred Provider Network. What is preferred? Between TPA, insurance company, and hospital, we have a complete list of PPN, and they agree to be in the network, where they will agree the norms of TPA, they will agree the norms of insurance company, and all the three will be totally involved. There is a separate site is there in IRDA. They have clearly mentioned who are the network hospital and who are the PPN hospital, and based on that, a common understanding between these three, TPA, insurance company and hospital, this will be in practice. So you remember who are involved in PPN and who are involved in network, and how it is practiced. This is enough for you. Okay, now we'll go to pre-existing and adverse history loading. And with this, I'll just give you a break for you, because now almost going to be at 11:30. Take 10 minutes for a tea break. We will see these templates, because seniors might be knowing all these things. Juniors may not be, those who are fresh for the exam, those who are fresh for the company, and they may not, fresh for the company means they are appearing after some time for the exam. They may not be knowing in depth about these things. Some aspects they have to know. That's why I'm managing both seniors and juniors. So these topics I'll be rushing through, but what are important for examination point of view, what are the changes is newly introduced by IRDA. For example, you take pre-existing, earlier it was 48 months. Now IRDA standardized in all insurance company, it must not be more than 36 months. That's what you have to know. And again, earlier you see the 2 years waiting period, and there is a 4 years waiting period. Now IRDA has standardized 3 years, not 4 years. So these changes I will be telling you while I'm talking about the slides. Okay. With this, I'll give you a break. You please have a cup of tea or coffee and come back. I'll be back within 10 minutes. Okay. Shall we get a break?
Yes, sir.
Okay. Okay, shall we start? Are you all ready?
Yes, sir.
Shall we?
Yes, sir.
Yeah, okay, thank you. So I just, we were discussing about the common template. In fact, we are discussing, still it is not completed. And I am just trying to make you to understand each and every word, because medical words are not that easy to understand. Unless you understand, then only you can able to pick up the right answers. That's why I'm explaining you each and everything. So pre-existing disease, you know already, I told you that was existing already. If it is coming after that, it's called acquired. So acquired is automatically covered because it's unexpected uncertainty. Pre-existing is a certainty, but it has got some waiting period. The waiting period has been reduced to 36 months now by a new IRD regulations. We will see, especially IRD regulations, we are going to see more for examination point of view in the later slides. Okay, so you know that a condition, ailment or injury, the insured person had signs or symptom or diagnosed, probably would have got treated also earlier, but there must be a waiting period of 36 months prior to our first policy with our company. So it is already there means, so naturally you have to understand that he cannot immediately make a claim. So he has to wait at least for 36 months. Then coming to adverse history loading, I was explaining you where we can load adverse claims history loading, adverse medical history loading. Claims history loading is now prohibited by IRDA. History loading, medical history loading you can do, that is diabetes, hypertension, elevated cholesterol, and here they have to go, normally they go maximum of 30% loading of premium, that they can go. So here what you have to understand, just because they paid extra premium for diabetes or hypertension or excessive cholesterol, that doesn't mean that they can make a claim later for any direct treatment of these diseases. For example, a person as a diabetic patient has taken a health insurance policy. You wanted him to pay extra premium because he's having a morbid condition. He paid. That you must tell him that it is not that he's paid 10% extra or 30% maximum extra, he can make a claim for diabetes later. No. Any medicines he's daily taking, regularly taking, lifelong taking for diabetes will not be reimbursed. But any complication, unexpected complication arising out of existing disease can be covered. For example, diabetic retinopathy, diabetic nephropathy. That means a diabetic patient need not get any problem with the eye, but some diabetic patient may get a problem in the eye. That is called diabetic nephropathy. Retinopathy. This retina, eye retina is affected. That is called diabetic retinopathy. Some few of them might get these complications. It is unexpected. For that, because he paid extra premium, because he declared he is having a pre-existing adverse condition, morbid condition, we are paying the claim. Like nephropathy, because he is controlling medicines, exercise, food, but still some of them may get a complication like kidney issues. That is called nephropathy. For that, if he has paid the premium, extra premium for his morbid condition, he is eligible for the claim. That is what you would understand here under adverse medical history loading. Okay, we will go to next slide. And extended 2 years disease excluded. See, there are some diseases that is there in a human body, but he may be knowing, he may not be also knowing. For example, you would have taken a policy. After taking the policy, within 6 months, he will come for a claim for a piles. He will say, sir, I don't know, at the time of policy, I am having a piles. Now only I came to know I am having a piles. In such cases, the benefit or doubt shifts here and there. You cannot take it for granted, oh, he doesn't know that, unfortunately it has come, so we will pay the claim. No. There are some people intentionally take the policy, knowingly they are going to get operated, they will try to exploit the insurance company. That is why we have put 2 years waiting period clause, whether they know it or not. We have specifically mentioned there are some diseases for which they have to wait, whether they know, they are not knowing, whether disease has got a symptom or this disease has no symptom, asymptomatic, but they have to necessarily wait for such diseases called cataract, benign prostatic hypertrophy. Benign prostatic means prostatic gland becomes enlarged. It's only case of male, it is not for female. Hysterectomy for menorrhagia. Hysterectomy means removal of uterus. Menorrhagia means excessive bleeding during cycle, menstrual cycle. So if they remove the uterus, If they come and say, no, my wife was not having that 2 months before, now only after taking the policy she got having this problem, her uterus should be removed. No, we cannot give, because knowingly or unknowingly they have to wait at least for 2 years, because we don't want them to exploit us. That's a hysterectomy for menorrhagia. Fibroma, a big stone-like structure, fibroid uterus, removing that. Hernia, hydrocele, congenital internal disease, fistula in anus, piles, sinusitis, related disorders, all this in gallstone, rheumatism, everything we have explored 2 years. Here one thing you must notice. Here they have put congenital internal disease. Note down, congenital internal disease. Why they have put congenital internal disease for 2 years? Is it mean that after 2 years they can make a claim if there is a congenital internal disease? Yes. See, congenital means it is existing at the time of birth. Please understand. Congenital means it's existing at the time of birth. When it is existing at the birth, it is known to the person, right? Then how can he say it is come after that? He cannot say anything wrong, no? When it's at the time of birth, he must be knowing what. But there are some diseases a person, a human can know that he is having at the time of birth. There are some diseases a human being cannot be able to understand that he has got the disease at the time of birth. For example, you know, a big head, it's called hydrocephalus, big head, or more number of fingers. Normally we have 5 fingers in a hand. He might be having more number of fingers, 6 and more. So these are by birth it is there. Or hand may not be normal, it may be very shorter than the other hand. A deformed leg, anything may be there at the time of birth. Or deafness, by birth he might be having a deafness. By birth the eyes may be blind, or the eyes may be having a cataract. It's called congenital cataract. It is not the old age cataract. So these all are known to the person. For that it is already existing. We cannot give any claim for congenital external diseases at any time. Even after 2 years also we cannot give for congenital disease at any time. External disease. But there is an exclusion or exemption in 2 years class for congenital internal disease. What is that? The baby is born, the parents may not be knowing the baby have got a heart defect at the time of birth because it's internal. The baby will be developing as normal. After some time, the baby will not be able to respire. After 5 years, 6 years, even it can come after 10 years. And the baby is not able to respire, normal breathe. So they take it to a doctor. The doctor finds the baby is having a defect in the heart. How come? The parent may ask. The doctor may say, the defects has occurred at the time of birth, but the hole is very small. The baby was managing. Now the hole has become a big hole, heart hole, septal, interseptal defect, what we say medically. So you have to undergo a treatment. The hole has to be closed, stitched together. Open heart surgery is needed. So the doctor might say, unfortunately the parents are not aware. They have taken a policy. They waited for 3-4 years. After that they come to know that baby who is covered as a dependent has got a septal defect. So for that we cannot exclude. That is why here specifically they mentioned under 2 years congenital internal disease after 2 years if it is not known to the parents, if not known to the insured or the insured person, that can be covered. So that is why they put this internal disease here. Please understand. Coming to the next one, joint replacement. Normally the degenerative condition like osteoporosis. Osteoporosis means thinning of bone. The bone has become very thin. It can easily break. Even small fall will lead to a fracture. Especially ladies are more prone after menopause. Osteoarthritis, overweight. All this can come. But we cannot take a policy knowing that we are going to get treated. That is why we intentionally put 4 years earlier. Now IRD has regularized across the country for all insurance company, it should not be more than 3 years. So this 3 years class is new. 2 years class is not new, but I just made you to understand why congenital and totally excluded. It is excluded only for 2 years because there are some conditions where the parents or the insured or insured person may not be aware that he is having. For that we can we can definitely help the customer. Okay. Coming to general exclusion, waiting period 30 days, already I told you. Whenever you read 30 days, you always remember, it is not 30 days in everything. What are these 30 days? 30 days covers only disease. There is always an exemption for accidents. If an accident occurred within 30 days, the waiting period will not apply. The question may be a simple question for a junior. They may be narrate a story. He has taken a policy. They put a date, and after 15 days of the policy date, they may say he met with an accident. His legs got fractured. He got admitted. The claim, whether the claim is payable, they give an answer. You have to find out as a senior whether it's occurred within 30 days, fracture, or more than 30 days. Even whether it's within 30 days or more than 30 days, it's a fracture, it is an accident, automatically covered. That is how you have to select the answer. Pre-existing discussed, chronic discussed, congenital we discussed, cosmetic and circumcision. This is all coming under exclusion. What is cosmetic? I don't want to have my face, I want to change my face like a Michael Jackson. Michael Jackson has underwent cosmetic surgery for more than 40 times to change his face. So for a cosmetic reason, to make myself more handsome or beautiful, that is not payable. But cosmetic surgery happens in coordination with a cancer. There was their cancer in the throat. They have to do a cosmetic surgery after curing the cancer. That is payable. A cosmetic surgery happens after a fire accident. That is payable. But general cosmetic surgery, just to face changing, body shaping, not payable. Circumcision. Circumcision is nothing but removing of this tissue over the male sex organ. And suppose it is done for a religious reason, it is not payable. Suppose after certain age, old age people, some senior people may not be able to urinate because that's preface. The skin go and close the urinary hole. So they have to undergo a treatment to remove the skin so that they can normally urinate. That is due to a disease, due to a problem. That is payable. But circumcision for beautification, circumcision for a religious reason, removing of the skin over the male sexual organ, it is not payable under general health insurance. Dental treatment. Dental treatment of any kind is not payable in a regular policy. There may be a specific policy that I am not going to talk because it's not there in our 4 companies. Dental treatment due to an accident, and that is payable. Dental treatment due to wear and tear, replacement of denture, and malocclusion, they have to change it. They are putting a clips, metal clips to make alignment over the tooth. That is all not payable. Routine eye checkup, cost of spectacles. I told you, anything over the body, your spectacle is over the body, your specs is over the body, is not payable. Routine eye checkup not payable. But there is one exemption, refractive index, where when it is payable, when it is not payable, when there is a problem in the vision. That is, I will talk to you later. But routine eye checkup not payable. Contact lens, hearing aid. You remember what is this kind of thing? Whether it goes inside the body, whether it goes external the body. Hearing aid over the body. Contact lens over the eye, not payable. Supportive and debility, just for the sake of giving some strength, stamina. They are prescribing Ensure, they are prescribing Bonvita. No, it's not payable. Unless otherwise there is a disease and you need some protein support, where they give a supportive in the way of mineral, protein, that is payable. But general supportive and debility not payable. Irrelevant diagnosis. They are trying to use all the equipment what they have purchased in the hospital, but that is not required for this patient. For example, uterus problem, and they have to take only MRI for uterus side or a CT scan uterus side. There is no need to take a brain CTC. So irrelevant diagnoses are not payable. STD, sexually transmitted diseases, AIDS, all are not payable. Here I want to tell you one thing. There is a new norm has come from IRDA for AIDS patient. What IRDA said, just because he is an AIDS patient, you should not say that you will not give any regular policy. You decide, if you don't want to give a regular policy to an AIDS patient, you design a new policy exclusive for AIDS patient. You don't cover for AIDS, but you cover for his other ailments. This is a new regulation has come that we will discuss later. But generally, standard health insurance policy, sexually transmitted, we never say BD. In olden days, we used to say BD. BD means venereal disease. Now we don't use the word BD, we use STD. STD means sexually transmitted diseases. Okay, it's all not payable. Maternity, voluntary termination of medical pregnancy, it's called abortion colloquially. If the mother doesn't want to have another baby, they will go into abortion. That's medically is called VTMP. Whether it's covered, intentional VTMP is not covered. Voluntary means intentional. So medical VTMP, to save the mother, they have to remove the baby. That is payable. But maternity, normally not payable unless otherwise specifically covered under group policy, or there is specifically conducted a specific policy, but not under standard policy. Okay. Naturopathy. You see here, naturopathy, here it is mentioned, but IRDA says Ayush must be covered without any deductibles, without any slab. In Ayush it comes AYUSH. Y means yoga and naturopathy. So naturopathy cannot be an exclusive treatment. And suppose if it is connected to an ailment, it's a standardized and approved practice is conducted. Under naturopathy, that is non-allopathic treatment, it could be covered. But in allopathic treatment, naturopathy is not covered. Please understand. See, a person is undergoing a treatment in allopathic hospital, naturopathy is not covered. If a person is undergoing a treatment in Ayush hospital, where naturopathy is a part of treatment that is necessitating as a supportive, that is covered. That is what you have to remember here. Intoxication. What is intoxication? Over excessive alcohol. The alcohol damages the liver. The doctor says his liver has totally gone because of alcoholic cirrhosis. Alcohol damages the liver. That is not payable under intoxication. And general exclusion, war, nuclear invasion for all policy. Apart from that, the new exclusion recently incorporated in our standard health insurance policies are genetic disorders, stem cell implantation, change of treatment from one system medicine to another. What is change of medicine? See, I am undergoing treatment in allopathic hospital. Some of my relatives coming and telling this allopathic hospital is a waste. You should have gone to some Ayurvedic hospital in Kerala. Why don't you go to Kerala and continue to get treated there? So by my own, I am leaving this hospital. That is not payable. But the allopathic hospital is advising you to try alternative medicine under their approval. That is payable. So change of treatment from one system medicine to another not payable unless recommended by the consultant or the treating hospital. Okay. ARMD and this ARMD is nothing but age-related macular degeneration. And this is rotational field quantum magnetic resonance. It's a new type of technology that is being used, but still it has not been proven. So unproven methods like this rotational field quantum magnetic or EECP are not proven treatment, so they are not covered. Okay, but age-related macular degeneration now IRD is said to cover. That I'll cover later. But generally, this kind of unproven treatment are not covered if it is not done by a regular way of proven practice. That's called ICD. It's International Classification of Diseases and Procedures. According to that, if it is done, it is payable. Unproven system like EECP, still now all allopathic hospitals are also doing. But if practice this unproven, it's not payable. Admission, registration charges, service charges, surcharges like TV, and for other people, and for bed charges for attendant and diet charges for attendant, all are not payable under general health insurance. Non-medical expenses. There are non-medical expenses. There are two types. One is disposable type, one is not disposable. For example, gloves, injection is a non-medical, but it has to be disposed. Certain things you will not be disposing it. You will be using it, nebulizer, like that. So what happened earlier, all the insurance companies have excluded non-medical expenses in toto. Now IRDA has come out, don't exclude non-medical expenses. Give an add-on cover. If they select add-on cover, please cover that also, provided if it is a part of the treatment required. A nebulizer required for an asthmatic patient, please reimburse it. So provided he has paid a premium, he is opted for an add-on cover. So please understand, non-medical treatment expenses, earlier it was not covered and it came under general exclusion. Now it is not under general exclusion, provided if you have an add-on cover, if the customer has opted for it, you have no other option. If it's a part of treatment, you have to reimburse. Okay. Now, under domiciliary, we have gone through all details of hospitalization and what kind of hospital, what kind of treatment is being carried on, what is covered, what is not covered, what is the science of medicine, everything we discussed. Now we go to the second part, domiciliary hospitalization. What is domiciliary? Treatment taken at home. Why do we take treatment at home? There are many reasons. Serious condition of the patient does not allow removal to hospital. My grandma fell down. There was a what do you say, damage to the foot. It could be a small minor fracture, or it could be a what do you say, a damage to the synovial membrane, and medically we say no, that some contusion. That means that's the impact of damage, because I fell down, and that force that on my foot could have definitely damaged the inner small bones, or there may be swelling, anything, or pain, anything. My grandma is already 70 years old, but I've been covering the grandma more than 10 years in my dependent things. And in that case, whether I'm not able to take her to the hospital, or the doctor says, no, your grandma cannot come to hospital, I will come and treat. So doctor is visiting the home. So serious condition of the patient does not allow removal to hospital. In that case, if he or she get admitted, treated at home itself, that comes under domiciliary. Lack of accommodation. There is an infectious disease everywhere, corona. There is no bed in the hospital. You talk to hospital. Hospital says, don't bring the patient here. There is no accommodation. Doctor will come and give. You be at home and a secluded or a quarantined home. We will come. Or this disease may spread to other people, like your infectious disease like dengue, malaria, and jaundice. So better be at home. Doctor will come and treat. So, and that also possible. If, as per doctor's advice, if the patient has to necessarily get treated at home, that is also come under domiciliary. So serious condition, lack of accommodation, all are taken as a factors for domiciliary hospitalization. There are two things you should remember. It must be there for more than 3 days. See, just a cough and cold, I took a cough tablet, I'm treated at home, but only doctors prescribe the medicine. Whether it's payable, but within 3 days, it's not payable, but it's continuing for more than 3 days. Where doctor comes and visits, he charges for that. He gives a prescription. In that case, it is payable for more than 3 days. That you should not forget under domiciliary. And pre and post hospitalization expenses not covered under domiciliary, but it is covered under hospitalization cover. But in domiciliary, it is not covered. And again, domiciliary is not maximum sum insured. See, hospitalization, if you have taken 1 lakh, indemnity policy. But restriction. In the domiciliary, it is not maximum sum insured. It is restricted liability. Generally, it is, if the claim is below 1 lakh, and if the sum insured is below 1 lakh, not claim, sum insured is below 1 lakh, 1 lakh and below, you take it like that. Of course, the claim also will be like that. Only 20% of the sum insured, only 20% of the sum insured up to 1 lakh will be reimbursed under domiciliary. In case of sum insured more than 1 lakh, only 15% of the sum insured only eligible under domiciliary hospitalization, not the full sum insured. So it's a restricted liability. This 2015, whether it's still followed by all 4 companies, it's a normal for all 4 companies, but you don't remember it. But always remember, it is a restricted liability. It is not of full sum insured. You cannot make full sum insured claim against a full sum insured. Okay. Then coming to what are the exclusion under domiciliary? Not all the diseases that is happening at home is payable. Asthma, bronchitis, chronic nephritis, gastroenteritis, diabetes, epilepsy, hypertension, cough, cold, mental diseases, urinary tract, tonsillitis, laryngitis, arthritis. You may be thinking, sir, almost all the diseases are excluded. Yes, these diseases, if it is manageable, they cannot come under domiciliary. If it is not manageable, they must have been admitted in hospital. Automatically it is covered there. But if it is manageable, it is at home. For example, diabetes. He is taking tablet every day. Can we pay under domiciliary lifelong? No. Hypertension is taking tablet every day. Can we? No. Unless otherwise, it warrants a medical professional visit and evaluation. Treatment is a new one, not an existing one. Then only it is payable. Here, what is this PUO? PUO is nothing but pyrexia of unknown origin. What is pyrexia of unknown origin? There is a fever continuously. But I told you, for a domiciliary hospitalization more than 3 days, if there is a need for a doctor to visit, it is payable. But except this condition, PUO. The doctor should visit only, continuous visiting if the patient is suffering more than 10 days. Then only under PUO you can make a claim for domiciliary. What is PUO? Pyrexia of unknown origin. What is pyrexia of unknown origin? He is having fever, doctor comes and treats for malaria, is not cured. Then doctor says, it is not malaria, my medicine is not worked, let us treat for typhoid. He is treating for typhoid, not working. Then again he is treating for some other disease, not working. For 10 days the fever is continued. Then doctor says, no, it is not possible, you better admit in a hospital. If it is more than 10 days, whatever treatment taken at home, that is payable. And automatically if he is admitted, it is automatically come under hospitalization. Suppose after 10 days, the 11th day he got cured, but he was treated for PUO, different kind of drug. He has incurred some expenses, doctor visit, that is payable, but provided it must be more than 10 days, not more than 3 days. There is only one exemption under the 3 days class under domiciliary hospitalization. Coming to maternity benefit. Maternity benefit is not a standard cover under standard health insurance policy, but that much you know. It is an optional cover mostly for group policies. You cannot, floater policy also not same for all 4 companies. Some floater policy of some company has got out of the 4, but not. But you must know, maternity benefit is not a part of the cover under standard health insurance individual policies. It is only optional cover under group policies. What are the speciality of this? It's optional cover. Where a group, for example, 1000 people are there. Out of 1000 people, 100 people are women, 900 people are men. And how to get the premium? Can we get only from the 100 people, women has to pay for it, because they are the only people who are going to have this benefit of this cover. Can we do? No. If you do it, it becomes selection. If you do it, selection and adverse selection is not allowed in insurance. So the entire group, including the male population, has to pay under the overall premium 10% extra to opt the cover to take care of the other 100 women. So remember, it's an optional cover. The entire group, whether they are male or female, they have to pay on the total basic premium. It must be opted at the inception. It is not in between the policy, during the course of the policy, midterm not allowed, at the inception. Maximum benefit, standard policy 50,000. Now there is a lot of customized policies are there, but generally maximum benefit is 50,000. What is the special condition of maternity benefit? Domiciliary not covered, only hospitalization covered. Please remember, you learn about waiting period, 15 days waiting period. You learn about 30 days waiting period. You learn about 90 days waiting period and critical, but here you receive the waiting period is 9 months. So whenever you remember waiting period word, you always try to recall the different kind of waiting period, 15 days, 30 days, 90 days and 9 months, because 9 months is a waiting period for avail the benefit of maternity. Why? Insurance company cannot cover once known she is already conceived, she is already having 2 months baby, now she comes for a maternity benefit. Cannot be, because certainty, she is going to have the baby soon. Okay, but immediately after marriage, nobody knows whether she will conceive or not, uncertainty. That is why even before 9 months, the fertilization is not known whether there will be a fertilization. So uncertainty time. That is why the 9-month waiting period. The 9 months waiting period worldwide is same, not only in India. So the waiting period is 9 months for maternity benefit. Medical emergency. Okay, and except for medical emergency means waiting period 9 months, except for medical emergency means that is automatically covered under health insurance policy. There is no need for a waiting period. For example, I told you extra uterine pregnancy. Okay, that is suppose the baby is developing outside the uterus, and when the mother is going, the mother has not taken maternity benefit cover. The mother is regularly visiting the gynecologist, and the last scan, the gynecologist, first 2 scans she couldn't find out. The last scan, the gynecologist says, "Ma, you have a problem in your uterus. Your baby is not growing inside the uterus. It's developing outside the uterus. And definitely the baby should be removed. Otherwise the baby may be a problem and your life is threatening." So they undergo emergency treatment. For that, There is no need for maternity benefit. Even standard health insurance policy is taking care. It's also called ectopic pregnancy. You all know that, ectopic pregnancy. That's why it's mentioned. Then again, maternity benefit is only for first two children. First two children, please understand. Suppose you may ask me a question, sir, first birth itself twins. So second birth, no. Already two children has come. So second birth cannot. First birth only one children. Second children is eligible. So only first two children, remember. Then no voluntary termination of pregnancy first 12 weeks. This clause has been recently modified by IRDA. How they modified? Instead of voluntary not at all covered. Because if the mother doesn't want to have a baby, because she cannot manage another baby, they go and terminate before 12 weeks. Because after 12 weeks, they cannot go and terminate. Because if at all, if the mother doesn't want to have a baby, as per Indian Abortion Act, the parents can decide to terminate the baby before 12 weeks. Then it becomes voluntary. Then it becomes optional. It is not uncertainty. It is something voluntarily done. So insurance company cannot reimburse such kind of termination. Suppose after 12 weeks, the doctor himself says it should be terminated in case of ectopic pregnancy. Automatically it is covered. Again, one more thing, no pre and postnatal. In domiciliary, you study no pre-hospitalization and post-hospitalization. In maternity, you study no pre and postnatal expenses. What is pre and postnatal expenses? Pre means before delivery, the wife or the sister or the lady goes to the doctor and having all examination whether the baby is growing well, whether the baby is having normal weight, and whether any blood circulation is going properly to the baby, the placenta is in a good place. This examination is called prenatal. After delivery, and suppose if there is any other expense that happens to the mother, and the mother is having some problem, that is not covered under maternity benefit. That may be covered under normal standard policy. Okay. Now, coming to the common template applicable to all four companies. Cancellation, enhancement of sum insured, reinstatement of sum insured. Cancellation, if there is a fraud, if there is a misrepresentation, it is proven, and he has been already made 2 claims in the last year, again making false claim. Insurance company can give a notice, 15 days notice in a registered post, and they can terminate, cancel the policy. So the 15 days notice from the insurance side. The insured, he doesn't want to have a policy, he doesn't like the insurance company, but he can want to have a proportionate basis of premium for the rest of the policy period, unexpired policy period, wherein he has not made any claim. So within 7 days, he can give a notice. So that's the days you might remember. It's a common for all four companies. Enhancement of sum insured. When we can enhance the sum insured? Waiting period clause in the policy applicable to enhance sum insured. You see, I have taken a policy for 1 lakh. Okay. 1 lakh policy already 1 year over. Already I have crossed the waiting period of 30 days. Okay. So my normal infectious disease, any treatment is automatically covered. And it is already there. It was there in the first year. Then my some other waiting period, like 2 years waiting period, like 3 years waiting period, some pre-existing class also 1 year is over. Second year I am coming for renewal. The second year I am not renewing for the same sum insured 1 year. Please note it down. I am not coming for same sum insured. This year I want to increase sum insured for 2 lakhs. So the insurance company has increased for 2 lakhs. Accordingly the premium is also charged. But a claim comes. When a claim comes, the disease for which he is making a claim, whether that sum insured was existing for more than 2 years, whether sum insured for the disease, if it is required for 3 years waiting period, whether it is crossed 3 years, that will be looked into that, and accordingly the claim will be settled. That is why the waiting period clause in the policy applicable for enhanced part of sum insured. Just because he has increased the sum insured, he cannot make a claim for the total sum insured. He can make a claim for the previous sum insured, but the balance for which he has enhanced, for that portion, he cannot make if it is falls within the waiting period. That's what you have to understand in case of enhancement of sum insured. A complex question might come for a seniors. Whether you know the enhancement of sum insured cannot be applied for a case or for a condition for which a waiting period is required. That you must know as a senior. Midterm addition. Can we add anybody during the course of the policy? Only 2 things we can add. one married couple. Marriage can happen anytime. No, you can add a spouse or a newborn baby, and no other thing you can add. No other dependent, father, mother, no other children. Children you can add after 3 months. No, that's a newborn. Okay. So that's what you have to understand midterm also. Then coming to reinstatement of sum insured. The reinstatement of sum insured is not common for all 4 companies. All companies has got different concepts, but certain things are common for all 4 companies. What is that? Sum insured reinstated as soon as the entire sum insured exhausts during a claim. Suppose how the applicability of reinstatement of sum insured, how it happens in all 4 companies. If somebody has opted for reinstatement of sum insured, suppose I have taken a policy for 1 lakh, but I got the policy still 6 more months to expire, but for a disease I made a claim for 1 lakh and more, automatically the policy is exhausted. If I got opted for a reinstatement clause, that sum insured will be automatically reinstated. For reinstated, some insurance company may have extra premium, some insurance company may have an inbuilt premium. The original premium itself they would have charged extra. So I don't want to go in depth because it varies among the 4 companies, but I understand the logic. The reinstatement of sum insured, the premium either charged along with the original premium, or it could be an inbuilt, that is inbuilt cover, or it could be a cover which can be taken after the exhaustion of the sum insured. And midterm cannot be included. Reinstatement, if at all, if somebody wants a reinstatement sum insured, it should be opted in the beginning itself. He cannot opt in the midterm. That's what you have to understand. Reinstated sum insured will be replaced for illness other than for which the sum insured exhausted. Please understand. I have taken a 1 lakh policy. Okay, I got admitted for some disease. For example, for a disease like lung infection, you take it for lung infection. 1 lakh is already over because I was admitted in a critical care unit or ICU. Every day ICU they charge about 30,000-40,000 per day. The 1 lakh is nothing for that. Within 2 days 1 lakh will be over. So after that I got discharged. Luckily I started breathing myself. I got discharged. But I'm not sure whether I get another lung infection again the same, because if I'm not properly taking care of myself, the lung infection may come. Immediately I reinstated. But suppose the lung infection comes again during the reinstated period before the expiry of the policy, this reinstated amount will not be applied for the same illness for which already is claimed. That's what it says. Reinstatement sum insured can be utilized for illness other than for which the sum insured exhausted. Reinstated sum insured can be utilized, but then what for reinstated? If it is a family policy and if it's a floater policy, reinstated there. I may not be eligible because I may be getting the same illness, but for others they can get. See, reinstatement sum insured can be utilized by other persons also subject to eligibility. Suppose they are dependent and they come and they have a floater policy and their policy also reinstated sum insured is paid based on that. So that's what you would understand under reinstatement sum insured. Coming to tax benefit. So now I have covered common to all. Tax benefit you have to understand. The tax benefit comes under 80D. Whoever pays the premium other than cash, they are eligible under taxable income. How much maximum they can deduct under tax, not the amount of premium paid. Please understand. Not the amount of premium paid is totally deducted. Under taxable income, he would have got some income tax amount. No, under that he can deduct. So what are the section it comes? See, there are some sections. For people below 60 years, there is one eligibility. People above 60 years, there is one eligibility. Under 80D, this is more connected to insurance. Under 80D, maximum 25,000 he can claim under deductible, taxable income, he can deduct 25,000 if he has paid premium other than cash. And if it is more than 60 years, he can have maximum 50,000 rupees. Suppose the proposer is below 60 years, he has covered a dependent parent. So in case of maximum, he has paid a premium for both. So he can get 25 plus 50, totally 75,000 he can make a claim. So 80DDB is different, 80DD is different. 80D is taxable deduction on medical expenditure incurred, includes premium paid for health insurance, self, parents, children and spouse. This is what important to us. Section 80DDB, tax deduction on expense incurred towards treatment of specified diseases. See, for example, he has incurred expenses for treatment, but not everything is reimbursed by the insurance company because his sum insured is less. But he should get some benefit, because he has paid premium. So under 80DDB, the government is helping him that he can make a claim. If he is not get reimbursement from insurance company also, he can take for a specific diseases. Under 80DD, the tax deduction on medical treatment of a dependent who is a person with a disability. Only for person with disability, he can make a claim under 80DD if he is not reimbursed under medical expenses by insurance companies. So remember, 80D is more important. How it is actually utilized, you see this table. Below 60 years, maximum 25,000 under taxable income. Above 60 years, maximum 30,000 under taxable income. How the 30,000 comes? 25,000. You see, above 60 years, 30K, but here you must understand, earlier it was 30K. Don't get confused. Now it is 50. How the 50 comes? Now for senior citizen, premium, preliminary health checkup, when the insurance company insists, medical expenditure in one or all together, either if he has paid more premium, he can maximum 50K he can eligible. Preliminary health checkup, either one or all. Total also comes up to 50K. Or in one itself, we have spent more than 50K. Not more than 50,000 is eligible. So please understand here. No one in your family has attained 60 years of age. So how much he can eligible? He can eligible 25,000 for him, and for his parent 25,000. Totally under 80D he can eligible 50,000. He is the eldest. He has taken, but he is not 60 years. He has covered his parent. So 25 plus 50, he can take 75 under taxable income. This 50, not only the premium, also it includes premium, preliminary checkup, medical expenditure and things. The 25, not only premium, it also includes preliminary checkup for the persons below 60 years. Then, I am itself a senior citizen, but I am having a very senior, super senior parents. My parents are continuously insured for more than 10 years. They are 80 years plus. 80 years plus are called super seniors. So I myself eligible 50,000. My super senior parents are eligible for 50,000. That 50,000 includes of either premium or all put together, including medical expenditure in one or all together. So maximum I can avail 1 lakh. So please understand, a person in India, maximum under taxable 80D, he can avail up to 1 lakh, provided if he himself is a senior citizen, provided if he has covered his super senior parents, provided not only the premium, even all other heads he has incurred expenses like preliminary health checkup, medical expenditure in any disease, he can make total 1 lakh. That's what the possibility in 80D. Okay, now it's over. So now we have covered all the templates. What all common to all 4 companies, we have covered. Now I told you, first I will talk about how you should prepare for exam. I have interpreted even one single subject matter free look period, how it has got so much of information I discussed with you. So preparing for exam, you should know the subject thoroughly. Second thing, I already told you what are the common templates for all 4 companies. Though now we say not Mediclaim, we don't call it Mediclaim, we call it based on the age group. Okay, we call it as platinum, gold, senior citizen. Of course, we call it like that. All 4 companies also calling it, but there is minor variation among us. But I didn't touch the minor variation. I discussed only the common template applicable to all 4 companies. Now we are getting into the next slide. IRDA regulations on health insurance products. IRDA regulations on health insurance products. It's very, very important because I told you, for studying for exam or health line of business, you cannot study only those there in the IC 78 book. IC 78 book is incomplete. It covers more on regular other miscellaneous insurance, not health. To study health, you have to read IC 27, but that is not required for you. Normally, people who are appearing for associate exam, they will read the book. But what all important for exam in IC 27, I've already touched. I'm going to tell you also in the forthcoming slides. So you need not buy the book. You need not study. Already you are loaded with many topics like marine, fire, engineering, and so many. I don't want you to buy the book and study, but if you keep my PowerPoint slide, if you listen to my words, if you recall whatever we discussed, that is enough. I'm sure you will get the best mark in your exam under miscellaneous, particularly in all miscellaneous, apart from liability, in IRD, in health also, you will not miss any questions the wrong way. So come to IRD regulation. This IRD regulation, what is this? 2013, the first they started making one thing. That is not regulation. They made some suggestions. The suggestion they floated among all companies. They asked feedback, because before making a mandatory regulation that must be followed by all companies, they only floated some suggestions. Why should not we do like this? That is started in 2013. And subsequently, the suggestion, they got all the feedbacks, they made it, some of them mandatory in 2016. They improved the mandatory regulation, and some they have deleted, some they have added, some new things they added in 2019. And they started doing it almost periodically. And 2010 also they did it. And 2024, resting with 2024, that is last year, they brought up lot of amendments, guidelines and circulars. So this is what we are going to discuss now with these slides. So what are the things they have introduced? They have introduced some standardized health insurance product in health, in PA, in travel. PA already covered, I have already covered in the last miscellaneous class. In this class, I am going to cover health and travel. Then they also brought, you cannot simply exclude whatever you want. You should not simply include whatever you want. These are the things you must definitely exclude. These are the things you must not exclude. It must be included. So permanent exclusion and exclusion not allowed. That means inclusion. They have made some circulars. According to the circulars, I don't want you to remember the circular name, the circular date, the circular sections. I don't want, because it's very impossible for a human being. But you should know what for the circulars are made, what it takes care, what it is covered. I don't want you to go to IRDA side, because I know your time is limited. You are nearing exam. You cannot go and learn new things now. Already what are you understood, what are you learned, you must keep on remembering. Then only you will not get confused. So I don't want you to go to IRDA side, because IRDA side has so many circulars. But all I made in this slide to make very simple, make you to understand. So follow me, you will be able to understand what are these circulars that says, what one insurance company should follow, whether you are a public sector or a private sector. But public sector, all four companies must follow. We'll see one by one. See, anyone in this class, they made it 45 days. I will discuss with you. They told ID card must not have TPA logo. Earlier, ID card had a TPA logo. Now it must be insurance logo. Age at entry, I already told you. The 65, no restriction up to 65. Even if they are above 65, you should design a policy to take care of all age group. That's IRDA. Cashless treatment. You must keep cashless services for all allopathic treatment. That is a regulation. Then hospital, they have changed the definition based on the population, not based on the bed, rural or not based on the rural or urban. That I already have discussed. I don't want to tell you again because my time is limited. I cannot tell you again. If you go back over my slides, you can see that what now changes are occurred based on the population. Critical care. Critical care, everyone has got their own definition. But IRDA now made, these are the names of the critical diseases. These are the conditions for which you can consider reimbursement of claim under critical care. So they have given some definition. I don't want to give you all the names of the critical diseases because you are not a doctor, it's not required. But you should understand some diseases for which when you have to give the claim, when you cannot give the claim. That I will tell you. Policy is portable. Now, the choice is given to the customer based on the protection of the policyholder's interest. If he doesn't like an insurance company, he can go to the another insurance company. And if he wants to go from individual policy to group, he can change. That is called migration. If he is changing the insurer, it is called portability. So that is the difference. What is the norms? That is we are going to see. Withdrawal of product. Can I withdraw as I like? No, this is a loss-making product. I want to withdraw. Suddenly I withdraw the product. How can I leave my existing customer? So some norms have been incorporated. What is that? We'll see now. Premium for individual policy. Once you charge a premium, you cannot going on charging every year. Once you charge a premium, how long you can continue the same premium? Wait. I'm only rushing. Don't feel that I'm not telling. I will be going to tell you individually later. But I'm only refreshing your brain. These are the regulations that are floating now. Maternity, I already told you. Now, maternity, already we discussed. Particularly, if anything required by law, a termination, it must be reimbursed by insurance company. That is a new norm by IRDA. Multiple policy. If somebody has got multiple, whether he can make from only first company, we already discussed in the sample question in the beginning of this session, New India and New United India. So it's a choice of the customer. Then newborn baby, you can cover from 90 days or 3 months onwards. Customer information sheet, yeah, every time when you issue a policy, you must attach a CIS form, customer information. A new regulation has come. If it's required, you can put in local language. What kind of fonts you should use? You should use only Arial font. And the size of the font, everything is defined by IRDA regulation now. Room rent, I already told you, though the standard policy says 1% of the sum insured, there is some variation. I told you where the variation comes, depends upon the hospital, proportionately whether they have only one room, basic room with the same charges. If it's a super specialty hospital, how do the insurer should act? All this comes under room rent. TPA cannot take everything granted. A claim cannot be reported by a TPA. It must be done with some norms. And whether I can change the TPA, I don't like a TPA. I don't want the TPA. Whether I can change, yeah, a new norm has come. We will see what is the norm. Alternative treatment. I don't like allopathy. Can I immediately switch over to Unani? No, unless the attending doctor advises you. Non-medical. Can I exclude all non-medical? No. If there is an add-on cover, you have to give. And all these network hospitals, all these PPN hospitals must have been registered with IRDA registry. IRDA has got a registry. That registry is called Rogini. What is Rogini? Registry of hospitals in network of insurance. So these are the important things. So these words, remember, Rogini means Registry of Hospitals in Network of Insurance. NABH, National Accreditation Board for Hospital. This is the board that says that this hospital is eligible for insurance. This hospital has got enough infrastructure. Insurance company can recognize, insurance company can honor. So what we say, if the hospital is registered or recognized by NABH, we can give you a claim. If the hospital is local hospital, not a proper hospital, no infrastructure, no proper doctors are there, we cannot give insurance claim. So to become a network hospital, to become a PPN hospital, it must be a NABH hospital approved by NABH. And what is NHRC? National Health System Resources Center. What is this? The entire data, whatever happening in India through way of medical insurance, all data must have been submitted to IRDA. IRDA has got a treasury. The treasury, the data is being stored. So IRDA is able to know what kind of claims are coming under which classification of disease, ICD. So they will be able to know which disease is more in which zones of India, how much being charged for that kind of disease, what is the hospital charges, and whether the hospital charge is reasonable. So they will be able to know, analyze the data for the future purpose. For that, a different center is working. That center is called National Health System Resource Center. Health Systems Resource Center could be able to give you the entire data, what is involved with the transaction of health insurance in India. So these three abbreviations you must know. That's important for juniors. Seniors also is good if you know. Then I told you, under critical care, IRDA has come out with some regulation. I don't want to teach you all the names of the disease, but certain things you must know for a regulation and insurance examination point of view. Permanent neurological deficit to be assessed no sooner than 3 months. This is a new regulation. What is that? Somebody made a hit again in a wall or a motorcycle accident. He got a head injury and the doctor is telling that his brain has got damaged. Can we give a claim immediately? No. It must be assessed after at least after a period of 3 months. Before 3 months, if somebody is assessing he has got a neurological damage, the claim should be paid means insurance company cannot pay, should not pay. The correct judgment can happen whether he will be recovering or not, whether neurological damage is permanent only after 3 months. So there is a waiting period of neurological damage, 3 months. Then only it will be considered. After 3 months, if the doctor says there is a damage to nerves, he cannot recover, then it will be treated as a critical care problem. So that is what you would remember. And again, burns. Just for a simple burn injury, can you make a claim? Normal, there are some burn injury can be treated at home. There are some burn injury necessitating hospitalization. That is called third degree. It cannot be treated as outpatient. So if it is treated as inpatient and discharged after 2 days, it is a normal disease. Normal standard policy can take care. But if the person has taken a critical care policy, then can be covered under critical care policy? No. It is not coming under eligible under critical care. It's a normal injury warranting hospitalization. So standard health insurance policy will take care if it is hospitalized. For example, first degree, second degree, like that, if there is a need for a hospitalization. But if it's a third degree, where the scarring is more than 20% of the body, it is not only warrants hospitalization, it also takes care of the category of critical care. So he is eligible to make claim not only under standard policy and also critical care insurance policy. That's what it is defined in critical care injury under IRDA regulation. That these two things you must remember, not the names of all diseases. Okay. Then coming to optional cover, I already told you. Under non-medical, don't exclude forever. There are two types. One is called durable medical equipment. I told you example, nebulizer. And non-durable, that is disposable. I told you syringes, gloves, and napkin, and your throwables, napkins and the other thing, all these things come under that. Whether it's covered or not, you have to be very clear. If you want to cover, you can make an optional cover, you can get an add-on premium. If they are incurred, you have to pay. If they are not opted for that cover, you need not, you can exclude. So that's what important. And discharge voucher. IRDA has come out with the regulation. Just because you are given a discharge voucher and the person has signed and got the money, that doesn't mean that the claim settlement is over. And the claim can be even reopened later immediately if he comes to know he has been not justified properly for his actual claim. Intentionally you are not allowed some claim which otherwise he is eligible, he can make a claim. So it's not a final and full payment. See, normally what we say when we talk about discharge voucher, it is considered as a final and full payment. It is not final payment. That's what IRDA says. So a story may come, the discharge voucher would have released, and again the person would have again made a claim. Whether the claim is payable as per IRDA norms, the discharge voucher doesn't mean it's a full settlement. He still has got eligibility to make a claim if his claim is not properly honored. Then fees to TPA. See, some insurance companies are giving fees more if the TPA is rejecting lot of claims, because lot of amount is saved for the insurance company. Now IRDA has found out. So TPA should not be. See, TPA, why I am telling this thing, TPA amount is based on some percentage. IRDA is fixed 5.5, they fixed rate. But doesn't mean insurance company should pay 5.5% of that money. TPA, all TPA is not the same infrastructure. Some TPA they will get income from insurance companies for doing the work, maximum 5.5. But some insurance company TPA may not come because that's a deal. And they will say, if you want me to enroll you as my TPA, I will not pay 5.5, I can only pay 3%. So TPA is agreeing. So this is what happening. But some insurance company, what they do, I will pay only 3%, but if you are not going to give a lot of claim, if you are rejecting a lot of claim, and I will pay you more, this kind of attitude should not be there. So fees to the TPA shall not be related to reduction of claim cost. This is a regulation by IRDA. The non-allopathic treatment, OIS treatment, fully covered, no deductibles and no slabs. And if it's treated in government hospital or teaching and medical college or hospital recognized by NABH. So this comes, the only changes, if it has got 5 bed, that is enough, it is already coming under qualifications. Okay. Then coming to guidelines on standardized exclusion. I told you, there are some diseases should not be excluded. There are some diseases should be excluded. You should never cover it. There are some you should not say that I will not cover. So what are that? IRDA come out as per the circular 2019. Disease not to be excluded. That means it must be covered. What are? Disease contracted, acquired after the policy. Understood. Hazardous activity and hazardous sports. See, hazardous activity means if a person has taken a health insurance policy, he happened to work in a mine. But when he has taken a policy in a normal work and he is working in a pharmacy and a claim comes, he has not disclosed the fact that he has changed his job and he has gone to a mine, PA policy will not cover because there is a non-disclosure of material factor. So PA policy story is different. But in health, just because he has not told, he has changed his job and his job is now involving some hazardous thing, he is working in a tunnel or he is working in some mines, you should not exclude the claim. But a person who is involved with hazardous sports is always going for a sports event, another thing, it is excluded under policy. So just because he is involved by nature of his job and hazardous activity, that should not be excluded. But hazardous sports can be excluded. Drugs prescribed, side effects, impairment. See, sometimes doctors will prescribe a drug that will damage the liver. So doctor will also prescribe drug to improve the liver. So the side effects to nullify, he will add another drug. And the insurance company should not say, no, this disease, this drug is not required. No, if it is side effects, impairment, if a doctor prescribed, he is a better judge, that should not be excluded. Age-related macular degeneration. Age-related macular degeneration, earlier it was disallowed. Now it can come to a person at any age. But if he is continuing the policy and if he is a senior citizen, already is covered and automatically it must be covered. So age-related macular degeneration should never be excluded. Puberty and menopause disorders. See, puberty and menopause itself is not covered. But any complication arising of puberty or menopause definitely must be covered. It should not be excluded. For that you should create a provision. These are the IRDA norms. And mental illness. Earlier what happened? Mental illness was not covered under domiciliary hospitalization. But mental illness warranting hospitalization in a mental hospital was covered because it was hospitalized. Now they say if it is a mental illness, if it is hospitalized, you should not exclude, you should take care of mental illness, psychotic disorders you must cover. So these are the things you must not exclude. Then one more important thing for seniors. A question may come as a story. The person got admitted and is undergoing a treatment, is in a critical care unit, his body system was working, slowly his reflexes changed and he has come to a vegetative state wherein he is continued to be in IC unit. So far he has incurred this much of amount and after coming to vegetative states he has incurred this much of amount. How much the insurance company can settle the claim? They will ask. Please understand, artificial life maintenance. That means he is put into ventilator. What is artificial? Ventilator means the ventilator will give you life. It will pump in and pump out the air, oxygen. Our lung will not do. Instead, artificially it will be done. That is called ventilator support. So artificial life maintenance up to declared as vegetative state. What is vegetative state? He will be aware. His life will be there, but he is not aware what is happening. He may not be able to identify who is in front of him. But he is alive, but he is not able to. He may open little his eye, but he will not identify who is in front of him. It's called wakefulness without awareness. If he has come to that stage, wakefulness without awareness, up to that stage, whatever expenses incurred in hospital, insurance company must pay. But once wakefulness without awareness comes, he is not able to identify anybody. but he's still alive, but his reflexes are totally out. In that stage, called vegetative stage, any expenses incurred after that stage will not be paid by the insurance company. That is one of the important standard exclusion under IRD regulation. Disease to be excluded. This you have to exclude. What are pre-existing 36 months? Enhanced sum insured, I already told you. That disease for which already claimed, it not comes under enhanced sum insured. Change of gender, it's very common in foreign country. They don't want to become a male, they want to change a female. Intentionally they are changing the gender. That is not covered. Obesity, see obesity, a question can come for seniors. Obesity unless on advice. See, if it is a BMI 35, see there are obesity means there are two types. Some obesity warrants, if they are not doing the operation, he may die because it's a fatal obesity, wherein the BMI index will be more than 40. Some obesity below 35 need not require any treatment. So if there is an advice by doctor's side to save his life, it is more than that 40 BMI, that claim cannot be excluded. But anything below 35 can be excluded because it's normal body weight, over body weight, he has to reduce the body weight. Maternity except ectopic and accidental miscarriage. So maternity cover is not there in individual policy, but ectopic cover automatically covered in individual policy. Accidental miscarriage also automatically covered in individual policy. There is no need for maternity expense add-on cover. Then already existing cardiovascular disease, already existing kidney, liver, pancreas, epilepsy, sarcoid disease. Sarcoid disease is another disease. It's kind of disease. Malignant neoplasms, brain stroke, cardiovascular disease, hepatitis B. Hepatitis A is infectious disease, that is covered, that is viral. Hepatitis B is something different and it will be there lifelong, it can even spread to others, so that is not covered. Parkinson's, Alzheimer's, loss of hearing, demyelinating disease, AIDS, these all you can exclude under standard health insurance policy. If you want to cover AIDS person, other than AIDS you can create a policy. That I have already told you. But general policy should exclude if he is already living with the disease and coming for a standard health insurance company, health insurance policy. Here you should not exclude at any cost. These are the conditions. Okay. Now coming to IRD regulation in underwriting and renewals. What are the norms applicable to all four companies while underwriting and while doing renewals? We are going to see that. See here you must note one thing. I am not talking about IRD regulation number. I am not talking about IRD regulation date. I am not talking about IRD regulation serial number, circular number, all these things. It's all not required for you. IRD regulation, what is important as on date, that includes, that is till it is applicable. It could be made 1 year before. It could be made 2 years before, but still it continues to apply. It could be made even last year. So I have taken only those regulations important as on date must be practiced by all four companies along with all other general insurance including standalone insurance company. Here because it is compulsory for all four companies, I am talking the logics, I am talking the norms as per the regulation. So if you know the norms as per the regulation, that is enough. You need not mug up like your motor policy, you may have to mug up a lot of sections. Don't mug up. Please understand these are the things that must be practiced. We'll see one by one. What are the things must be practiced by all four companies while underwriting and renewals? What are the things that we have to do while claim settlement? What are the things we have to do during migration, portability and moratorium period? These three things is very important, and especially when you want to withdraw, what are the IRD regulations you must follow, and what is the, apart from this, what are the new regulations? This is what we are going to see now. See here, one by one I do. IRD regulation for underwriting and renewals. A renewal should not be denied. There is no age limit. I already, see whatever I discussed, I don't want to talk again. My energy is being lost. And moreover, time is also being lost. So you recall, I already told, you should not, once I am there for 10 years, because I crossed 65 years, can you deny my renewal when I am attaining 66, 67? No. That's why it says no age limit for renewal as long as I am alive. Okay. Then cumulative bonus, I already discussed with you. The way you increase in case of claim, the same way you should decrease. You should not totally nullify the cumulative bonus. Then simply for renewals, don't ask him to go again for medical exam. Once you got a medical exam at the time of first renewal, first policy, for fresh proposals, there is no. Once you got a first policy, it's okay. But for renewals, you should not insist for again medical examination. Okay. Another TPA. Yes, if somebody wants to change the TPA, and the insured can give a notice 30 days and they can change the TPA. Commission. Suppose you want to change the company to one company to another company, the commission cannot be given under portability policy. Combi product. Can be joined with a life insurance company for health? Yes, you can join. That is health and life policy. That's called combi product. That is normally available in case of micro insurance. Please understand. I've already discussed about micro insurance. You see my slides in miscellaneous PPT. Okay. I've given the total amount for individual policy and group policy also under health. Okay. Then UIN. UIN means unique identification number. That means to protect the policyholder's interest, if somebody has taken a policy with you for health or somebody has taken a policy with motor, you already got a proposal. Okay. And the proposal, you sought lot of detail, the name, address, and his demographic detail, his age, everything you got it. That is the proposal you obtain for one line of business. When it comes for any other line of business, you must use the same proposal. You should not insist every new proposal for every one of new policy. And you must use from the same proposal. That is what? Protection of policyholders' interest. For that, you have to give him a unique identification number. Once you are given a unique identification number, if you use that number, automatically that proposal will be fetched to your data, and he need not give you a new proposal, and based on that you can go. If it is really required, medical examination, you can go. But all other detail you cannot seek from him. What is his name? What is his age? That all not required. One proposal is not enough for multiple insurance policy. That is what they say UIN, unique identification. It is based on the protection of policyholders' interest. The minimum group, I already told you, I explained to you, 7 number. It should not be formed for the sake of insurance. Can be devised mechanism reward policyholders? Yes. Earlier, what is reward policyholders? Suppose they are a member of the club. They are maintained by club members and they are being healthy. They go gym and they go for health clubs and their health is being monitored. And if they prove that they are attached with a recognized clubs, and if the health is hale and healthy and they are not making a claim, you can give some reward points. The reward points you can give by way of increase sum insured or any reward point you can give. Okay. So a bonus, anything you can give. That is also possible as per the new regulation. Okay. Then I told you customer information sheet must be provided along with all policies, and that information should contain, if necessary, local language, because you can't expect everyone to read English or everyone to read Hindi. Their language, their mother tongue language, it must be made, that CIS, and the font size must be not less than 12 and preferably Arial font. Because Arial font is a standard font, so that is also prescribed by IRD regulation. Nomination is compulsory in all policies. Earlier we never asked nomination, we ask only for a PA policy. Now nomination is compulsory. Then modern treatment, advancement of medical technology, specified illness, okay, like your laparoscopy and all other things, okay, computer aided surgeries, all these things must be included, and it must be specified on which category it's covered, whether it's covered under regular standard policy, whether it's covered under daycare, it must be covered. These are the there under your, it must be there in your policy, must be there in your underwriting also. Coming to a claim, empanel hospital must be there in the website, so that customer should know which are the hospital he can go. 100% cashless must be carried out in case of allopathic, and cashless decision must come within 1 hour receipt of request. He should not take his own time. He should not put the patient into trouble when making claim. And pre-authorization, you should not immediately should give online, digital mode. And final authorization within 3 hours of discharge. So once discharge is going to be made, and the hospital should contact the TPA, within 3 hours they should clear. And in case of death, it must be immediate so that the patient can that deceased person can be taken away from the hospital by the nominee or by the proposer or whoever may be. Okay, so that process must be immediate. They should not take its own time once the death has occurred. These are norms at the time of claim payment. Okay, then no claim to be repeated by the TPA. TPA cannot be repeated. An insurance company cannot repeat a claim. Who can repeat the claim? A claim must be repudiated. It cannot be repudiated without the approval of PMC. PMC means Product Management Committee. So they have a review committee. So this committee has got claims review committee, and CRCs, they have a claims review committee. A minimum 3 members group is there. They should decide whether the claim should be repudiated. Once they say the claim can be repudiated, TPA can repudiate the claim. And disallowed amount to be shared. Suppose an amount to be disallowed amount to shared with the specific terms and conditions. And suppose at the time of settlement of claim, you are not settling the claim because for a cataract you will settle only this claim. But you should tell the customer, according to the policy condition, you have disallowed this amount. So you have to say quote the policy condition. You should make known the customer why you have disallowed. You should not simply disallow and leave the balance of claim amount. You should make aware why this amount has not been settled. That's what it says. It's all IRD regulation. Document submitted beyond certain period. Suppose there is a non-network hospital. Non-network hospital, document need not be submitted by the customer. That will be submitted directly by the hospital to the TPA, to the insurance company. But non-network hospital, and the customer has to submit, Suppose while submitting he made delay because he is totally indisposed. Indisposed means he is not able to move, he is not aware. After some time only he is able to know he has to submit the claim. If it's a reasonable delay, the claim should not be denied. That is why it says documents submitted beyond certain period should not be denied. It could be considered if the reasonableness is acceptable. The reason is acceptable. And TAT, what is the turnover time? Once all the documents are settled to the insurance company, the claim must be settled within 30 days. If it is not settled within 30 days, 2% of penalty will be imposed over the prevailing bank interest rate. And that must be extra added to the liability of the insurance company. Is very important. More than 30 days, and if it is unnecessary delay made even after submitting all the required document, without all the document has come, the insurance company has not intimated to the customer that still any document is required, but simply keeping mum, more than 30 days is over, neither settled nor intimated anything required, then automatically the penalty will be imposed as per IRD norms, 2% over the bank rate. Okay, that's claim settlement. Then coming to migration, portability and moratorium period. These are all regulations. So if you are following whatever I am sharing, suppose if you feel something you are not able to understand or something you need little more explanation, please read. This time what I did, I have given the entire description here itself in the slide, because sometimes I have to cover little fast. You may miss some of my words. So what I said you want to recall, you just open this slide. Whatever I told you, everything is there. I put on writing. Nothing, I have not put a small word so that only I will be able to know. Whatever you must know, for want of time, I may be rushing. I have given clear description. If you read this, you will be able to know. Migration, what all important for regulation point of view? If it is done within the company, it's called migration. If it is done outside the company, it is called portability. This question is important for juniors. But what is migration? How it is done? What should not be done? What should be done? What is the norms? That must be known by the seniors. For that you would read within the company, migration to suitable health product at the time of exit age, at the time of withdrawal. Suppose a company is withdrawing a product. the product's no more going to exist. So you can request a suitable product, you can ask the customer to go to a suitable product. So you have to create a suitable product if you are not going to continue with the existing product. Allow all suitable credits, whatever credits was there, it is not his mistake. You only withdrawn the product. So you have to making the customer to come to another product. So it's whatever he earned, like his credits, waiting period, bonus, you must allow. That's what it says. Okay, but without the break, okay. If it is a break, that you have to decide as per your policy condition. And sum insured, NCB, pre-existing disease, waiting period, moratorium. What is moratorium period? I'll tell you later. So these are automatically applicable if it's migrated from one policy to another policy of the same company. You should not deprive him. And migration is it possible travel insurance and PA policy? No. Migration is not possible. This is a very good question for juniors. Migration is not possible for travel and PA policy. What is portability? Portability is changing the insurance company because I don't like New India, I want to go to United India. And I don't like United India, I am going to New India. So all credit that is eligible under the policy should be taken to the next. What is the thing? Allowing credit gained with the previous insurance for pre-existing disease, time-bound exclusion, 2 year, 3 years policy, apply at least 30 days before, but not later than 60 days from the date of renewal. So if somebody wants to port from one company to another company, they have to apply to the new company before 30 days, not less than 60 days of next renewal from the existing insurance company, preferably before 30 days before, so that the new company will decide whether to accept your porting or whether any data is required from the existing company. So new company has to decide. So the 30 days clause is very important. Existing insurer to provide. So once I accept as a new insurer, I will ask the existing insurer. So the existing insurer should provide the detail required, not more than 72 hours. Within 3 days, I must get from the existing insurer. These are norms by regulation. Already IRD has put on the IRD site. If anybody is not following this condition, they will be penalized. So everyone must follow these regulations. Okay. You should remember at least before 30 days, but not 60 days from the due date renewal, not earlier than. You are able to understand? Yeah, they cannot apply 60 days before because renewal sticks there. So they have to go a little nearby. This is what the line says. Don't get confused here. Please understand. The policy holder to apply at least 30 days before, but not earlier than 60 days. That means the policy is going to expire after 100 days. Can I apply? Porting? No, you cannot apply. That's what it says here. This you should differentiate. Don't get confused, my dear friend, please. Then coming to no commission in porting in policy. Moratorium period. What is moratorium? Moratorium is nothing but it came during COVID period. The COVID period, the government asked those who borrow loan, they are not able to pay because they never get salary. They never gone to the job. So they don't have an income. So government said, bank people, see, every month he has to pay you in your installment. Now they are in COVID period. They are not having any job. They are not having any salary. So please allow them to have 1 or 2 installment to skip. So they can skip 3-4 installment. From fourth installment, once of the COVID period is gone, once they recover from COVID, they let them pay they start the installment. Just because they have not paid the installment, don't penalize them by fine. So this is what they said during the COVID period to the bankers. But in insurance parlance, it is not making the people not to pay the premium. Please understand. Or not to pay the installment. In insurance parlance, the moratorium is different. In insurance parlance, the moratorium period is if a person is having a policy without break, continuously for 60 months and more, that is 5 years and more, and 6th year he makes a claim, then that claim must not be rejected by the insurance company, telling that 5 years before you didn't tell that, you have not disclosed the fact, you should not reject. If 5 years he has been with you, it is your duty to know that whether he is having any problem or not. Just because he is lodging a claim in the 6th year. In the claim it says he is having the problem more than 5 years means you should not say no, you are having the problem more than 5 years. Now only you are telling that you are having the problem. I am able to understand from your discharge summary. You did not disclose, so I will not settle the claim. No, you should not do that. Once he is crossed 5 years, continuously has paid a premium. You should not reject a claim based on the fact that he has not disclosed the fact. Unless otherwise, this claim is a fraudulent claim. This is what it says. So, you understand? Moratorium period. The insurance company cannot repudiate a claim after 5 years unless it's a fraudulent claim. Then coming to the product withdrawal. Can I withdraw it as we are like? Being an insurance company? No. If you want to withdraw a claim, a policy, it needs approval at least 3 months before. Approval from IRDA is must, and you should also give a notice to the claimant, from the customer, because the customer has to decide whether to migrate to another policy or whether you leave your company to go to another company. So you should give a notice before 3 months of the withdrawal. I am going to withdraw the product from the market to the customer. That is more important as per the regulation. And not only that, you must also get approval before withdrawing from the IRDA. That also important. Then decision. Who has to take a decision? The withdrawal. Your product management committees. The committee should say, this is the reason, sir. The policy is loss-making policy. We have incurred heavy loss. We cannot continue to market, and this reason should be put up to IRDA. IRDA should approve. Then only you can definitely withdraw. Otherwise, you cannot. So you must remember 3 months notice, 3 months intimation in advance before withdrawal to IRDA. Who can give information to the IRDA? Not the insurance company. The committee should give them. Who is the committee? Product management committee. And the migration is as per the choice of, you should not compel him. No, you should definitely take this policy because I withdrawn. It is the choice of the insured. Okay. And premium received for the product withdrawal, policy not issued. Suppose you have received the premium in time before the withdrawal, but the policy is withdrawn immediately before the inception of the policy. In that case, you should not adjust the premium. You should refund the premium, full premium to the customer. That's also important clause under product withdrawal. And existing policy, already a policy is there. You have given a 3 months notice, but the policy is actually going to expire only after 4 months or 5 months. You should not abruptly discontinue the policy because it's an existing policy. Let it allow, you should allow it to get expired till that particular policy. That is what I say. If there is an existing policy, it should be continued until its expiry. You should not say, no, I have already withdrawn. I have already given 3 months notice to make aware that he is going to withdraw. But you should not discontinue the policy if it is going to have little more time or existing. That is called existing policy. If withdrawn, one-time option to be given to the renew under existing terms the policy. Even if it is withdrawn, you can give one-time option and you can allow him to get expired till the policy is there. When you can give one-time option, if withdrawn, one-time option to be given to the renew under existing terms if the policy expires. Renewal falls within 90 days of withdrawal. These days are important. So the one-time option you can give if the policy is falling within 90 days of the withdrawal. You can give one-time option to continue with the existing terms and conditions. So these are your true. And senior citizen, you cannot revise the premium as you like every year. Senior citizen, you cannot revise more than 10% every year. And if you want to increase senior citizen premium, you must definitely consult IRDA. Without IRDA approval, you cannot increase more than 10% of the premium for senior citizen. And withdrawal of any product affecting senior citizen also to be intimated to the insurance, to the IRDA, and you must get it approved. So senior citizen is more important to IRDA. That is what it says under this regulation. Then other thing what we have to see, IRDA guidelines. Guidelines on group health insurance policies upon merger of public sector banks. Guidelines on migration and portability of health insurance policy. What is guidelines on group health insurance policies upon merger of public sector bank? See, I have got a customer and the bank is Andhra Bank. I have tied up with United India Insurance Company. The Andhra Bank is no more existing now. It is merged with some other bank. For example, Canara Bank. See, the Andhra Bank has already got a policy with me for his customers, account holder. In between, before the expiry of the policy, the Andhra Bank is merged with the Canara Bank. What will happen to the customer of Andhra Bank? Whether they will continue with the Andhra Bank or they will have to switch over to the Canara Bank. So this is what described as acquiring bank and merged bank. Here acquiring bank is the Canara Bank, merged bank is the Andhra Bank. So what it says, insurance company shall make suitable arrangements with acquiring bank for continue to be serviced. I have to settle the claim only to Canara Bank because the policy is existing with the Andhra Bank. Still the policy is not expired. So the merged bank can continue to be respected insurance company for a period of 12 months. Till it is expiring, the merged bank, even though it is not existing, it is merged with Canara Bank, but it should continue the practice with the till the policy is expiring. That is what it says. Subject to the willingness of the corporate bank. The corporate bank should allow, okay, the policy is still there, but the bank is merged with me. But I need the help of the Andhra Bank until expiry. After that, I will decide whether continue with this company, United India company. I am taking a corporate agent policy, or I will switch over to my own insurance company where I got a tie-up. That decision will be taken by the acquiring bank. But till it is expiry, it is the hands of the merged bank. That's what it says. So how the insurance company should act in case of this acquiring and merged bank. Then guidelines on migrating portability. This already I told you. We already told you. In case of migration, it could be within the company. In case of portability, it is one company to another company. Within the company, if it is migrated from individual policy to group. And if it is migrated from another company, how do we go with the individual policy with the group? That's what they say. Here already I told you, a policy holder to migrate the policy along with all members of the family at least 30 days before the premium renewal existing policy. However, the insurer is willing to consider less than 30 days. See, a policy holder to migrate, he wants to migrate with the individual policy to group or a group to individual, whatever it may be, vice versa. He must tell the existing insurance, because migration is only for the existing insurance company, it's not porting. You must inform the insurance company before 30 days, at least 30 days before. The insurance company has to take a decision, okay, you are already there in group, now I will issue an individual policy. Or you are already there for more than 4 years, okay, I will change you from individual to group or group to individual. But the 30 days is not always mandatory. Even if it is within 10 days, the insurance company can take a decision. But generally, if a person who wants to migrate an individual to group or group to individual within the same company is expected to tell his existing insurance company within 30 days before the renewal date. That's what it says under these migration guidelines. Okay, then coming to next. IRDA guidelines new. Telemedicine, I already told you, we discussed. Guidelines for wellness and preventive, I already discussed. If he is in a club, we can give you some reward points. And insurance coverage over surrogacy. See, the surrogacy is a new trend in the world, especially now in India. What is surrogacy? It's nothing but test tube baby. Suppose a person may be, a couple may be there, the wife may not be having a proper uterus. So they have to collect the semen, the sperm from the husband and the egg from the mother. The sperm and egg cannot be fertilized in the mother's uterus because mother uterus is defective. So they will find out a surrogate mother who is going to volunteer that he will keep the egg and the sperm and the fertilized egg inside her uterus, and she will keep baby growing and until it delivered. Once the baby is delivered, the baby will be given to the original parents. That's called surrogate mother, wherein the mother's uterus is not eligible for childbirth. What is oocyte donor? See, the policy says insurance coverage for surrogacy. There is an act is passed by government, 2012, and it is amended in 2021. As per that, insurance companies should follow these new policies by the IRDA regulation. What the IRDA regulation says, you must create a policy for surrogacy, under surrogacy, for both surrogate mother as well as oocyte donor. So what is the policy for surrogate mother? You can give a general health insurance policy 36 months. For oocyte donor, you can give a general health insurance policy for 12 months. What is oocyte donor? Here, what is that? Husband semen is good. Mother uterus is good, but mother is not able to get egg. Mother is not able to give an egg. So she is getting egg from some other lady. That egg and her husband's sperm is utilized in her own uterus, and she will be a pregnant mother. So in that case, the oocyte who you donated the egg, the other lady, she can be given a cover maximum of 12 months. So this is what you have to understand. Surrogate mother, where uterus is not good. Somebody is going to bear the baby for this couple. Oocyte donor, the baby is good, the uterus is good, but this couple is going to bear the child, but the couple's egg is not good. So somebody will donate the egg on behalf of this couple. So that is called oocyte donor, where you can give a 12 months policy. You should remember, for examination point of view, 12 months for oocyte donor, 36 months for surrogate mother. What kind of policy? General health insurance policy. Okay, it's only general health insurance covering not standard health insurance policy, not specific to childbirth. Please understand. Okay, next we will go. New IRDA health insurance guidelines 2025. What all I discussed with you, I am going to summarize. See, health insurance plan for all age group, no upper limit, I told you. Pre-existing 36 months, I told you. Cashless, at least for allopathic, I told you. Moratorium period, 5 years, I told you. While you take into 5 years, even the porting and migration should also be taken into. Even if you change the policy, the previous year policy also to be taken into, so the continuation is there. That is more important. Okay, 5 years. Ayush, full amount, no deductible, no sublimits. Customized plan for senior citizen, children, student, maternity cases. IRDA says you must come out with customized plan. And specific disease waiting period now reduced to 3 years. Insurance cannot deny health insurance company to cover people who are having severe medical condition, morbid condition like people having cancer. You should not deny for a fresh person who wants to have a standard policy. But you can avoid a cover for the specific disease. But you can give a cover for other than this specific disease. Suppose a person comes with a AIDS, he wants a standard policy. You give standard policy. But don't cover anything connected to AIDS. But any other ailment other than AIDS, you please take care. That's what IRDA says. Okay. It cannot be denied because he's having AIDS. It cannot be denied because he's having cancer. He's a poor chap. He might get some other disease also. Why you are denying your liability for other diseases? That's what IRDA says. Model products for vulnerable groups. Vulnerable groups means people with disability, senior citizen, mental illness people. You come out with model products. So you should cover these people also. Allowance for multiple claims across the insurers. More than one policy. Primary insurance are coordinated with us. This is what it says. If somebody has got 2 policies, and New India and United India, we already discussed. But suppose United India has settled the claim. He wants to get the second claim for the New India. United India support New India with all the papers. At least Xerox copy, certified copy. Yes, this is the policy he has taken with me. This is the amount I have settled. Balance amount I have not settled. This is the fact. This is my document copy. He has to give to the second insurer. Then only the customer who is holding a multiple policy get. So it's a duty of the first insurer, even after settlement of claim, you should provide all the documents needed for the second insurer to settle the claim. That's all IRDA regulation. So I don't want you to read IC 27, but what all I missed in IC 27, it says some new things. For example, IC 27 says introduce lot of floater policies, give a lot of add-on cover, introduce lot of senior citizen policy, don't restrict age limit, even 70% can enter. Then when you introduce business and holidays extension, when you give OMP policy, you please give COVID cover also as an add-on cover. Hijack distress allowance. Suppose somebody is got hijacked and overseas, having a overseas medical claim policy. Give an ad hoc cover for a distress allowance. And in case of delay and cancellation of thing, you also, it's not the fault of the insured. In case of OMP policy, give him some emergency cash to help him. Cancellation means give him some emergency. He has to bear some expense. You would have come to, suppose his flight is in Chennai. He is traveling from Coimbatore to Chennai. There they are cancelled. So you need some cash for him, for incident expenses. So give him emergency cash. And adventure sports. So adventure sports comes under hazardous sports. It is not hazardous activity. Hazardous sports generally excluded. But somebody who wants a cover for hazardous sports, come out with innovative products. Then destination India policy. You do cover only people going from India to abroad. What about people working in India but they are from different country? A US man working in India, a Bulgarian working in India, a Sri Lankan working in India. What about for them? Introduce a policy called Destination India policy. Under that policy, if anything happens while they are working in India, like medical expenses, personal accident, okay, loss of baggage, delayed in baggage, okay, then personal liability and hijack, all this cover you please give to the persons who are working in India, reimburse in Indian currency because they incurred in Indian currency because of hospitalization. So these are there in IC 27. I just made you to record. These are the emerging, not what they say, emerging risk. They want us to create policies. That's all. So IRDA regulation with the insurance ombudsman. This is also a very common question about ombudsman. Ombudsman, what you have to know? Whenever you reject a claim or whenever you are attending a grievance in an insurance company, when you reply to the grievance, you must say what is the next step the customer can take. Your grievance is not taken care, it cannot be settled means you should tell him next step. If you reject the claim, he can go to ombudsman. In an ombudsman, how it is done? In the ombudsman, when he can go to ombudsman, suppose he is not satisfied with the claim and he is sending a grievance that is not attended by the insurance company or the broker, and is failed to give within the policy period of 1 month, he is not even bothered to reply to you. Or he is giving reply, but the reply you are not satisfied, then you will go to ombudsman. In ombudsman, the same thing I told you. And suppose if the rejection, you are not happy, the reason, and he is not replying in time, you can go to ombudsman. And another one, suppose he has repudiated your claim and you have taken little time, but no, you are not contacted the insurance company, but still you can go to ombudsman. But the time is expiry of 1 month of filing the complaint, the insurer fails to reply, or here you note the complaint is being made to the insurance ombudsman within 1 year from the date of rejection of the complaint by the insurance company. And if it is rejected, they are given little more time. Within 1 year you can approach the ombudsman. But now what is the changes? There are 2 changes occurred as per the new regulation. Now ombudsman limit has been increased to 50 lakhs. It is not 20 lakhs as what earlier. Now up to 50 lakhs ombudsman can consider the claim. Then ombudsman given an award. The insurance company has taken its own time to settle the claim. If the insurance company has not honored the ombudsman award within 30 days, every day there will be a fine of 5,000 rupees that will be borne by the insurance company. It will be penalized as per the new regulation of IRDA. So insurance company must settle within 30 days the award. That's what you have to know. Now IRDA standardized health insurance product. See, I have not completed the session today. Now I have to complete 2 more topics. What are the standardized insurance product? For example, you see, policy, these are the important things, Arogya Sanjeevani and a new product, Corona Kavach and Corona Raksha. What is Mashak Raksha? And apart from the government, there are few more policies are there I want to discuss with you. Then apart from that, if time permits, I got some questions that also I can discuss with you so that you can be very thorough before exam. Now the time is around almost 1:30. So I have got only 2 choices. I am asking you, you have to reply to me by opening your mic. Okay, I am asking you, whether you should suit to all. There are one option, I can continue still 2 o'clock. Another option, I can break here. You can have your meal. You can come back by 2 o'clock so that we can continue for half an hour or 45 minutes more. Why? Because afternoon class is not there for you. You are free today afternoon. The afternoon class is not there. So you can spend some more time with me after a break. So you tell me now whether I can continue now itself or you want to have a break. We can continue after the lunch.
Sir, we'll have a break, sir.
Okay. Because it's good if you have a break, the left out portion I can spend little more time, but I won't take more than 45 minutes or maximum 1 hour, including the question I can discuss with you. Because last year, miscellaneous, I could not discuss with you the questions because want of time. But some of you asked some questions like you want some numerical questions for first class basis. That first class burglary policy you asked. But I explained, but still I was not satisfied. What I did, I incorporated the question with a proper answer, make you to understand. In the PPT I shared with you. Probably if you would have gone through the PPT, your questions properly answered in the PPT with the illustrations. Like that, now if I leave you, I cannot answer because I am not going to come back again. So I don't want to take rush the balance of portion. It is almost maximum 45 minutes. So let us break for lunch. You energize yourself, come with a lot of energy. We will continue by 2 o'clock. Only a few more parts. This standardized product and question paper. Government is more important. And government policies, only 2 policies are there. You see, the standardized products, I will just show you the slides. Corona Kavach, comparison between Corona Kavach and Corona Raksha, Mashak Raksha. The question came last year. And standard domestic travel, a new insurance introduced by IRDA for domestic traveler. This is different from OMP. See, this is what is this and what is OMP. What you have to remember for OMP for examination point of view. Then central government schemes, Ayushman Bharat. Then one more scheme apart from Ayushman Bharat. What is the difference between Ayushman Bharat and Rashtriya Swasthya Bima? With this, we will go to question bank. And I almost will take only 45 minutes. So I'll wind up. I'm not winding up, I'm only breaking. So please have your food and come back by 2 o'clock. Right? Right?
Okay, sir.
Okay, sir. Okay, sir.
Okay, sir.
Okay, okay. Fine, fine.